Hang on, the doors are slowly opening. Okay, right. Welcome everybody to today's meeting of the Children, Adults, Health and Wellbeing Policy Development and Scrutiny Panel. So my name is Dina Romero and I'm a councillor in Southdown and I chair this panel, and I will now invite those members of the panel to introduce themselves. Liz.
Hello, I'm Liz Hardman. I'm Ward Councillor for Porton and I'm Vice Chair of this panel.
Paul? Ruth?
Hello, yeah, I'm Ruth Malloy. I'm one of the Western councillors and I'm a voting member of this panel. Thank you.
Chris?
Good morning, Christopher Batten, representing Teachers in the National Education Union, and I'm a non-voting member. Thank you.
Good morning, Kevin Burnett, Professional Association representative for the NAHT and a non-voting member.
Robin Moss, Councillor for Westfield, substituting for Leslie Mansell.
Joanna Wright, Lambridge Ward, voting rights.
David Howling, Councillor for the Chew Valley Ward.
Good morning, Councillor Onkar from Coombe Down and a panel member.
Thank you. And I will ask each of you, when you come to speak, if you could announce who you are as well. So thank you very much. We are also accompanied by Kerry.
Good morning, I'm Kerry Williams and I provide the Scrutiny Officer's support to the panel.
And last but by no means least, Mark.
Good morning everyone, my name is Mark Downford. I'm the Democratic Services Officer for the panel. Thank you.
Thank you, and we will turn back to Mark to tell us what to do in the event of an emergency.
Yeah, great, thank you, Chair. So, if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, we follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area just outside Brown's Restaurant. And there is an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated as a safe refuge where persons needing assistance should assemble. Thank you, Chair.
Thank you very much, Mark. Can I return to you for the apologies and substitutions, please?
Yes, of course. We just have one apologies from Councillor Leslie Mansell, and in her place as substitute today is Councillor Robin Moss.
Thank you very much. The next item is declarations of interest. Does anyone have any declarations they wish to declare? Okay. And then item 5, urgent business as agreed by myself as chair. So I have a number of items here that I want to raise with the panel. And the first one being around the calling of the decision made by the ICB to in awarding many of their services to HCRG. It is our understanding that this should have triggered a reconfiguration of the NHS services as opposed to a re-procurement process, and so we have been asked to support a call-in to the Secretary of State to Wes Streeting. I had asked previously offline for that support, and so I was just asking now if we could just acknowledge if we support this call-in, and this will apply only to those members of the panel that vote. So all those that are in favour of that, could you just indicate, please? Okay, so thank you. Laura, I understand you wish to make a comment at this point.
Thank you, Chair. If it would be helpful, I think a couple of things, if I may, just to consider. So it's right to say that a call-in request was made to the Department of Health and Social Care on 3rd of March from a member of the public. I think, as you know, we have discussed in this forum the key issues that have been raised previously. So notably, if you remember, we talked about the key concerns being around engagement and the nature of what engagement should have happened relative to the process that was followed, the robustness of the process, and I think the point that you've just raised there around service reconfiguration and transformation, it was a point of clarification. From day one, there will not be any service change or transformation, and I think we've always been very clear about that. The focus is on the safe and effective landing of services. So I guess I just want to make clear to this panel that clearly the nature of the call-in around that is not factually accurate, just to clarify that is what is going to be happening from 1st of April. As we've discussed in this committee, safe landing of services from 1st of April, then where there may be service transformation, clearly that will be worked through with key patient user groups, with those with lived voice, and indeed with the HOSC, and the panel will remember that we asked, Health and Overview Scrutiny Committees in each of the localities. You may remember that we asked you how you would want to work with us to make sure that we fulfil statutory obligations in that regard. So I just wanted to make that clarification, Chair, if I may. An additional piece of information. We did have a discussion similar to the ones that we've had here in public with the Wiltshire colleagues in their scrutiny committee. They too considered whether or not they would be supporting concerns being raised with Secretary of State. And on the basis of the information and the discussions that we had, they had decided that they would not. So I just wanted to make sure that the panel were aware of that, and it's just that I think it's quite an important point of clarification. This is not about service change and reconfiguration from day one. So I hope that helps, Chair, but respecting that obviously the panel needs to make the decision that it wants to make.
Thank you very much, Laura, and I think we all appreciate your words, and I think in this instance it may just be useful to have outside eyes looking at the situation and making, that ultimate decision about what was the right process. So that's what we will be doing. But thank you, Laura. Other items that I wanted to raise, one is that this, you may be aware that we have two members of our panel who are co-optees, and I wish to increase that number by adding in somebody from health. So we're going to look at Health Watch, and hopefully we'll be able to augment our numbers through that process. And then the final item I want to raise is that I will be moving the minutes, because we have two sets of minutes to approve, and I will be moving those to the end of the meeting. As I'm aware, it's quite a meaty meeting, and I feel that the sort of the administrative parts of it may be less enthralling for everybody here. Okay, so moving on to the next items, we have a number of public statements. Is Wendy Lucas here? Would you like to make your statement, please, Wendy?
My name is Wendy Lucas, and I'm one of the parents of a special need adult that currently uses Newton House in Bath for respite. On January the 13th, I addressed this panel to try to get you to understand what it means to raise a special needs child and continue to look after them into adulthood. I explained that over the last 28 years, I've learned to be many things: an OT, a nurse, a doctor, a care worker, a teacher, and a social worker. Since January, I, along with the other Newton House parents, have added a few more things to our resumes. We've given newspaper interviews. We've given 2 television interviews. We've become political researchers. We've become campaigners and, to a small degree, political activists. Surprising, really, most of us don't have a political bone in our bodies. We've also dealt with our first online troll who posted that we should be grateful for day centres where our children could play bingo all day. More importantly, we've been amazed and grateful for the support we have received, and I am personally thankful for the new friends I've found in the rest of the Newton House parents. However, we are now in March. And in reality, if Newton House is not going to be there after January 26, we need a solution by September 25 if our children are to transition to new providers in a sensible and safe manner. However, make no mistake, the parents' preferred solution is to continue with Newton House. It's far from perfect, but it works. And any granny will tell you, if it ain't broke, don't fix it. I continue to be exasperated by politicians at all levels who refuse to recognise our voice and talk over our needs. I understand that costs and budgets are important. Newton House is expensive. But I challenge each and every one of you to do what we do as parents each and every day, 24 hours a day, without it. But if Newton House is not there, when Gary can no longer cope with the full-time residential care for Shay, what will Shay cost you? When Derek and his wife are exhausted with the full-time residential care for Michael, what will Michael cost you? When Richard and his wife can't function without further support, what will Ryan cost you? When Rowena is exhausted, will you support Rosie, and what will that cost you? As a family, we've not had a holiday in 10 years. My husband will be 60 this year. When we buckle, who will be there to support Rhiannon? 24 hours a day, 7 days a week, 365 days a year. What will that cost you? We are people with names and faces. We are real families where our young adults are real people, not faceless numbers on a budget sheet. The clock is ticking, and we as human beings need certainty in an uncertain world. I keep hearing that the Liberal Democrats are the party putting carers first. They've even sung about it with the Bath Carers Choir. Perhaps Ed Davey would like to sing with our choir. It's not quite Cameron McIntosh's song of angry men, but it is the song of piddled-off parents who are being pushed too far. And it's also a group of parents who are sick of the sound of silence from local and national politicians. We need this panel to ensure that our families are not forgotten. We need solutions and an end to uncertainty. We need answers to our questions, and we need them sooner rather than later. Thank you for your time.
Thank you very much, Wendy. I absolutely appreciate this is very emotional. Would you be okay if anybody had any factual questions? Yes. Okay. Liz.
Wendy, thank you very much for coming again here, and I believe it's really important for you and the other carers to keep this whole issue relevant and in the news and not forgotten, because that is very, very important. I would like to ask you, the last time you were here, we were promised that things would happen, meetings would take place, and that Newton House would be looked at very carefully, and alternative provision might be looked at, but certainly Newton House would be looked at very carefully. Can you brief us as to what's happened since our last meeting and since you were last here?
So we've had a single meeting of parents with Dimensions, the company that run Newton House, and members from social services in Twerton last month. It was quite a feisty meeting. You were there. It was quite a difficult meeting. The biggest complaint that came out of that meeting is that as parents, we have been kept in the dark. We have a meeting at 11:30 today, which is the first of the promised meetings that Suzanne Westhead undertook to give us. In terms of a solution to the Newton House problem, at the moment there still isn't one. Newton House is the only adult respite short-term care placement available for this group of children who are highly complex. The social workers have now done and completed assessments for most of the 22 families, bearing in mind those assessments previously had not been completed. As a family, we hadn't had an assessment since 2017. So the department actually has failed to meet the statutory requirements for assessments for quite some time. If they were looking for a magic solution, that those new 22 assessments would somehow tell them that the children were better and no longer needed respite, I think they've realised by now that they're sorely disappointed. If anything, the needs of the children have grown, and as the parents have got older, our abilities to continue doing what we're doing for much longer is getting limited. Neither are there 22 places available in full-time residential care for these complex adults either, even if the council had the money to pay for those 22 places. They just don't exist. So some progress in that we all now know publicly that this need exists, but no solutions to the need going forward.
Thank you very much, and I do hope you will be able to update us in the near future with better news. Thank you.
Thank you. In fact, just so you're aware, the next meeting of this panel will be looking at this issue, and that's on April the 14th, so I do hope you'll be able to attend that meeting either in person or else online. So thank you. Do we have any other questions? No, but thank you ever so much for coming again. Thank you. So next I'm going to ask Emily Macy, the Chief Executive of the Partnership Trust, to make a short statement. Thank you, Emily.
Hi, good morning everyone. My name is Emily Massey. I'm the CEO of the Partnership Trust. I want to share with you some information about one of our schools and a residential provision that is part of it. The Partnership Trust is a multi-academy trust of 18 schools within the primary and special sectors, predominantly based in Bath and North East Somerset. Fossway School is one of our special schools located in Radstock. As part of the school, we currently offer an educational residential provision based on the school site, which we call Fossway House. So Fossway House offers a 24-hour curriculum for up to 11 students aged between 11 and 19 years, and they all have a diagnosis of autism. Students are accommodated for 39 weeks a year, which is the school year, from Monday to Friday, returning home every weekend and holiday. The aim of the residential provision is to provide a 24-hour educational curriculum that enables students to develop social and communication skills within a residential environment, independent skills, for example, personal care, develop community links within the community in which they live, and transfer educational learning into a different environment. It also helps to prepare them for living independently and ready for adulthood. The provision has been rated as outstanding by Ofsted for the past 3 years, most recently in January 2025, and is one of the strongest provisions, if not the strongest provision of its kind in the South West. It's registered with Ofsted as a residential special school. It's not a children's home and is not registered with the Care Quality Commission. We believe the provision that we provide is incredibly important for many young people for whom 6 hours at school a day is not enough time to generalise the development of independent social skills and life skills that are needed for them to fulfil their potential into adulthood. The students accessing Fossway House require an education beyond what the classroom can provide. The young people that attend take part in a wide range of educational and social activities that would typically not get the opportunity to benefit from, while simultaneously being able to learn and develop independent skills, such as shopping, using public transport, preparing their own meals, living independently. And students are encouraged on a daily basis to make decisions both for themselves and for their group. They require education beyond what the classroom can provide and are not able to access the learning that Fossway House facilitates within their own family homes due to their learning disabilities and the inability to differentiate between a home activity and a school activity, meaning that home is not seen as an environment where learning can take place. Fossway House seeks to break down these barriers to learning for those vulnerable young people and provides them with an environment where they're supported by a team of staff to learn fundamental independent skills. With continued support and by working closely with the families, the skills learnt within Fossway House are able to be generalised in the home and can lead students to being able to use this and to participate and contribute to a range of different learning environments in the future. Outcomes for these young people, their families and their communities are significantly enhanced through being able to offer this consistency of a 24-hour curriculum. For some students, Fossway House provides the missing link to their education and preparation for adulthood. Our outcomes are very impressive, and students accessing Fossway House are some of the most vulnerable students in the school, and are not only able to have a placement at risk of breakdown if they don't attend the setting, it also allows parents to work and care for their other children and dependents, and gives them the break that they need during the week. Since 2008, 48 young people have resided at Fossway House, and all of the students had a primary diagnosis of autism, and they live in the provision for a minimum of 1 year, the longest being 7, and the average likely to be 3 years. We're very proud of the outcomes. We have students, when leaving Fossway House, that go on to further education and then employment. We have students that go to further education and then supported living as well as other further education establishments for a huge number of students that we don't think would have been possible without Fossway House. Just a little bit of contextual information, if I may, around the cost of the residential placement. Placements in these provisions can be substantial, especially when their placement at school has broken down. According to 2023 report by the Local Government Association, the cost of such placements can range from £3,000 to £10,000 per week, depending on the needs of the child and the support that's required, meaning that the annual cost can be between £156,000 and £520,000. We currently are able to provide the places for about £30,000 per child, which is considerably less. So based upon a model of a minimum of 5 to a maximum of 11 students, Fossway House costs up to £30,000 per student. This is exceptionally low in comparison to other national figures and provides a 24-hour curriculum that upskills these young people. That £30,000 per student allows us to run the provision at a break-even point. We are not a profit-making provision. So the current challenges facing Fossway House is that we're deeply committed to providing the best possible future for our students, and Fossway House is a huge part of this. We also have done lots of research around the percentage of adults with autism that go into employment, and we feel that this is supportive of that. We also know from research and to the solutions that people being confident with their diagnosis and self is the biggest positive factor in mitigating against mental health challenges, and having a positive social identity is a protective factor against depression and anxiety. So recently, the local authority have for nearly 20 years funded students to attend the provision, but that funding has been allocated through their individual education, health and care plans, which are aligned to their needs. Unfortunately, notwithstanding a number of needs assessments still requiring completion, the local authority have reached the decision that they do not feel that there will be any young people within the authority who needs and requires a placement at Fossway House from September 2025. We don't believe this is accurate, and as an education provision which is wholly funded by the LA, the provision will no longer be able to function, and we will need to close at the end of this academic year. There's currently 7 students who are at Fossway House, and they will no longer be able to stay there from September. I thank you for listening to me today, and I would also welcome anybody that would like to come and visit to please come and see what we are able to offer, because me speaking to you today doesn't actually demonstrate all the fantastic things that we do at Fossway House for those young people to prepare them for adulthood and to be functioning parts of this community in which they live. Thank you.
Thank you. I'm going to ask Councillor May if he wants to respond first, and then I'll bring in any questions from the panel. Emily, could you turn your microphone off? I don't know quite what the issue is there. Would you like to use maybe a different microphone? Apologies for the technical delay. Paul, maybe we'll come back to you in a moment and we'll ask the questions first. Robin.
Thank you. Thank you for the presentation. First of all, can I say Fossway School is in Westfield. Radstock is a mile down the road, but it is down the road, so that's where the school is based. Can I ask for some clarification on the fact you've got Ofsted registration but not CQC? Because the costs that you quoted, as you say, are considerably less. And just your views on whether CQC registration and the requirements of CQC registration are actually related to the costs of providing placements within the school's residential.
Regarding the costs, not 100%. What that would be if we were registered with CQC. We would be happy to be registered with CQC, and that's something I know we've got a meeting around today.
Sorry, Emily, would you mind speaking into the microphone?
Yeah. Did you hear any of that? No. Okay.
Feel free to move it directly.
Okay. So we're not registered with CQC, and I don't know what the cost would be in terms of what that would mean to our provision. We've always been Ofsted registered, and the funding comes through education as part of the Education, Health and Care Plan for the children that attend. We've got no problem in being registered with CQC, but that generally means that it would be registered as a children's home, and that isn't something that we would be able to do because of where Fossway House is positioned in relation to the school. It's basically above the school, and we've had people come and look at it to say that it wouldn't be a residential house because it isn't a home for those young people.
Thank you, Emily. Joanna.
Oh, thank you. So in your statement, you said that the council have basically said that there won't be any children with these extra needs by a certain date, and therefore it's fine to shut down. Now, I'm aware one of the things is that we've been pushing for more EHCPs, sorry, I always get the term wrong, ECHP staff, because of the backlog of how many young people best within the system. So there seems to be some disparity in information going on here.
Currently, all of the children that attend the residential provision have an education, health and care plan, and they also attend Fossway School. So the backlog wouldn't have an impact on this. They already have an EHCP, and within that EHCP, the 7 children that are currently there say that they need a residential provision to provide a 24-hour curriculum, although through the reviews that's now changing.
I guess the wider question is, in your experience of working in this sector, you can see that there is endlessly a new cohort of young people coming through that need to be supported, and that in the future that's not going to disappear.
I don't believe so, no.
And therefore the provision you provide essentially makes sure that these young people are well educated and feel safe and have systems in place so that they can then go out into the world and live in the world and be purposeful humans.
Yes, that's exactly it. Of the 7 children that are currently there, we could provide for 11. We've got 11 rooms. Of the 7 that are currently there, 1 will be leaving because of his age, but the other 6 we believe would continue to do very well if they stayed there, and there are 4 or 5 others that have shown interest in wanting to attend from September, but obviously that won't happen if it isn't open.
So when all of this first kicked off, I was certainly alerted by a parent at that school about the situation, and I wrote to the cabinet member on this, and I was told that this was that the council did not essentially fund you, and that it was nothing to do with budgets, but it was your decision.
Well, we can't run it unless it's funded. 30,000 per student, and that's always for the last nearly 20 years come from the local authority. So obviously it's up to us whether we remain open, because it isn't a local authority decision for it to stop functioning, but we couldn't run it without the 30,000 per student. We've looked at alternative funding streams and it's just not possible within our budgets.
Thank you. Liz and then Kevin.
Thank you, Emily, for coming here to explain to us the situation. And it seems to be very complex and not particularly straightforward. And basically, these children are doing very well. The Ofsted report says how outstanding your provision of residential care is. But I just want to tease out a couple of things. Is Fossway House, the residential part of Fossway School, is it only open to Fossway students?
It is, but it isn't to say that it couldn't be for other students that required what Fossway House offers. So currently, all of the students attend Fossway School. We've looked at different models in that they could attend other schools and come to us in the evenings, but that would be based on complex needs around transport, that kind of things. But we wouldn't be closed to that happening.
And could I just ask, by the Chair, a follow-up to that? The youngsters who are at Fossway House, do their EHCPs say that they need residential accommodation? Because I think this is what's happening. Baines are saying that the EHCPs don't require this, and therefore you're offering this, which is a wonderful support to youngsters, but that they don't actually need this, and therefore that's why Baines are no longer going to support these youngsters to have a residential accommodation at Fossway House.
Well, the EHCPs have in the past stated that they need that, but that's changed at certain points during reviews, and we've needed to provide evidence every year as to why the residential place is right to meet the needs of those children. So some do and some don't, depending on what stage the EHCP review is at.
Well, if I had just one more. So that's the reasoning behind why Baines is saying they won't support it anymore. Thank you. And those children who are there, is there any other provision for them if Fossway House is not supported by Baines in the future?
They will stay at Fossway School. They just won't have the 24-hour educational provision. And I don't believe there's many provisions like that within this area, no.
Okay, I believe the final question falls to Kevin.
I think, Chair, it may have been asked almost the same question as Liz, but I'm not sure whether it is quite the same. Just to say about those 6 students in September that still require, or say they require, the residential provision part of it, do you know what that would cost and an alternative provision to that? If they are still, their actual EHCP states that they need residential support.
Do I know what that would cost if they
yes,
weren't at
if it goes somewhere else apart from you.
I don't know exactly, but it's considerably more than the 30,000 that we would provide for them. Anecdotally, some out-of-county residential provisions are upwards of 100,000 per student per year, but I don't know the exact costs of what that would be. I briefly touched on a few costs based on research that we've done, but I'm not exactly sure. It depends on lots of different things in terms of what their needs are and how those needs would be met.
Okay, thank you very much. Emily, if you'd like to turn your microphone off now. Thank you. We now move on to the... Sorry. Councillor May, have you sorted out your whistling microphone?
I think so, Chair. Thank you. For everybody in the room, I'm Paul May. I'm the Cabinet Member for Children's Services in Bath and North East Somerset, and I'm a councillor that represents Pensford and Whitchurch Village. I think, obviously, I've listened to the presentation this morning, and I take advice from our education SEND people, and the case that has been presented has been very clearly about that the Fossway House does not provide the educational needs of those young children in the way that the EHCPs require in the future. We're not stopping the existing children because they're there for a year, but I'm more than prepared at the next Children's Services meeting to bring a full report back, Chair.
Apologies, I pressed the wrong button then. Thank you very much, Councillor May. Okay, sorry, we're just having a little bit of a conflab here on whether or not the annual education performance report is coming next or not, Chris. Well, I've got double thumbs up, so I guess so. In which case then, I'd like to invite Councillor Paul May to introduce this item. I'd also like to remind Chris Wilford, when he comes to speak, to introduce himself as well. Thank you. Paul.
Thank you, Chair. I won't introduce myself again. But we've got a really important agenda today with the education performance, our colleagues from the Department for Education and Amy talking about the wider determinants around how we engage with communities with regards to education. So a very strong education dimension, and I'll just introduce straight away Chris to talk to the committee.
Hopefully, if we... Yes, he's ready to go. Chris.
Thank you. Chris Wilford, Director of Education and Safeguarding for Bath and North East Somerset. And just to follow up with what Paul said today, I'm going to provide a summary of last year's education outcomes, which I do every year at this time of year. But we've tried today to make the agenda something really interesting, hopefully for Scrutiny, to really understand the education sector in Baines, how it is, some of the outstanding work that happens and some of the things that we're looking to improve. So I'm really pleased we've got our colleagues here today from the DFE Regents Group to explain their role in supporting academies and trusts around Baines. You'll be aware that Baines is nearly 92% academised with only 7 schools that are run by the local authority. So it's really important that we are able to present all the players in the education system that support our children in Bath and North East Somerset to succeed. And also really pleased that Public Health are back with their action plan around improving or looking at the wider determinants of educational disadvantage in Baines. So I hope it'll give you a really good full picture of the summary of the outcomes and what it is we're doing to improve the outcomes for those children who we should be seeking to do, for us to do better on their behalf. So I'll just provide you with a summary of the report. Just to thank again our business intelligence team for the production of the report. I don't know if you've had the opportunity to go in via the link into the strategic evidence base. Each year I ask them to try and make that clearer and clearer so everybody can really clearly understand what it says about Baines' performance. I think this year it's getting better and better, and each year we're going to try and granulate that information down so that the public themselves has got all the information they need around that. So I'm just going to do the key highlights. So the positive thing is Baines again continues to perform really highly across the key stages. We're really pleased to see that the performance in the early years has improved this year. Overall, I'm talking about performance. We'll come on to specific groups shortly. And then particularly when we get into Key Stage 4, Baines' outcomes in GCSEs and progress attainment is some of the best in the country, and that should be applauded. It's better than national and better than average performance, and it's something that continues to be strong each year. In Key Stage 2, when we look at some of our education outcomes, we are slightly behind where we used to be in terms of the combined reading, writing and maths outcome. So we're above our regional colleagues in those outcomes this year, but we're just slightly below national. Prior to the pandemic, the Key Stage 2 outcomes, so that's in Year 6, you were higher than national. I do think that will return. I don't think it's a significant issue for Baines. If you drill down into that a bit more, you will see that some of the performance, particularly for boys and in maths, isn't as good as girls, although the gap has narrowed around that. So that I know is something that our trusts are looking at in terms of looking around the performance of those groups. And in I should have said Key Stage 5, which is our A-level performance, that equally again is very, very strong. You'll see that in the report. So there's a lot to be confident about in Baines in terms of the outcomes that our academy schools and our maintained schools are achieving for our children. But there are some familiar outcomes in the report again, and I'm sad to say it's a pattern that I've brought back here, and that is the outcomes of our children from a disadvantaged background. And just so you're clear about the disadvantaged term means, that's our children who are eligible for free school meals, and children who are also being care experienced. I'm pleased to say that it has improved in the early years this year, which is significantly.
8 percentage points.
So my colleague beside Julie Eden leads the early years service, and it has gone up significantly there. So we're really pleased with that, and we think that's down to some of the work that we do in the early years sector we'll talk about shortly. And it has slightly improved in Key Stage 2, only by a few percentage points, but it still does leave us in the bottom quartile of the number of the local authorities in the country. We're not at the bottom anymore, which is what we were last year. I believe we're around 6th bottom. It is an interesting pattern, if that's the right word, in that at the bottom quarter it does tend to be a lot of southwest local authorities where the disadvantage gap is more significant. But I'm not going to sit here and say that small increase is good enough. It's not. We can do better for our disadvantaged children in our schools in Baines, and we're looking at that at a granular level now, looking at that by trust, and having conversations with trust where we think performance needs to be looked at and see what support we can provide and the support that the Regions Group can also provide. In Baines, we have for some time worked really closely in partnership, and we will continue to do so with St John's Foundation to make sure that we're providing additional support. Some of that support is targeted at the schools with the largest numbers of disadvantaged children for Primary Empowerment Project. But we also run CPD for all schools, sessions on best practice and action learning sets to support our teachers to get those best outcomes for children, disadvantaged children in our schools. And we also have our Language for Life programme, which is now, pleased to say, rolled out across the whole of Selma Valley, and it's again supported by St John's, and that's providing additional support around language and additional speech and language to give our children the best start. And I think that is starting to come through. So overall, to close, just to summarise, lots to be proud of in Baines in terms of the academic results, but some of the familiar outcomes which we are committed to turning around and improving. And I want to hopefully get over today to the scrutiny panel a sense of the things that we're doing, not just with working with the education sector, but also working on those wider determinants. And as I said, our public health colleague will introduce that report shortly.
Thank you very much, Chris. If you turn your microphone off, I can ask the panel. If you turn your microphone off. Thank you very much. David.
Thank you, Chris. It's a really copious report, lots of good work in it, and some good outcomes. Could I ask on two things? One, would you be doing any future work on rural deprivation? You've highlighted it in a number of spots in there, but can't see too much looking at it yet, and I realise it's quite difficult to tease out. And the second one is, our young carers, how are they doing?
So I don't have the data for our young carers in relation to that. Business intelligence team hasn't broken that down. Whether it's nationally released, I don't know, but I can certainly ask that question on your behalf and see if we can get that information. In terms of rural deprivation, I think that's quite an interesting one. So the DFE statistics don't break that down by geography, but we certainly can do that. So we can have a look to see if there's any specific wards that we're aware of out in different areas. My colleagues just informed me are working on that at the moment in terms of providing that information, but I think we touch upon that in some of the public health work as well. And that's when we're thinking about the wider factors, so thinking about transport, access to other services, perhaps we don't have in the city, and I think that's an important part of this work.
So I now have Liz and then Onkar.
Thank you very much for the report, Chris. Lots of information there and lots of positive outcomes, but we're still stuck with that nugget of Key Stage 2 underachieving, especially when it comes to our disadvantaged pupils. And there's going to be a very wide report on this about poverty and all the other indicators in Agenda Item 10, so I don't want to preempt what I'm probably going to say there. But two of the main things that we are doing to try and tackle this underachievement is with St John's Foundation. And I wonder, do we have any outcomes? Because there's a 3-year programme has been rolled out. I think it's for 7 schools. Do we have any outcomes as to what improvements have actually happened? Because it's obviously a very good project, but we don't know, has it made a difference? And then you spoke about the Language for Life across the Somer Valley, which is obviously my area. Would really like to know which schools. And it's been rolled out over 2 years. And again, do we know any outcomes for that? Be interesting. And then my third question, thank you, Chair. If we're looking at free school meal numbers, the numbers are increasing hugely. And so therefore we need to be aware that we're going to, we need to be working to support these youngsters. And do we know, a motion was recently put through Council about auto-registration of free school meals by the Labour group. Do we know how it's progressing? I believe it's supposed to be in place by September, but just would like to know how that's progressing, because obviously that's going to be part of how we help our disadvantaged young people if we know who they are in free school meals.
So I will pick up about the outcomes and then the Language for Life one as well. And I think my Cabinet member will provide an update on the auto-enrolment. It's part of his report, but pleased to say that's progressing well. Can I hand over to Julie first to talk about Language for Life, if that's okay?
Yeah, hello. I'm Julie Eaton and I lead the Early Years Service in Bath and North East Somerset. Yeah, with the Language for Life, we had a pilot programme in the South West Bath and Keynsham areas for just over 2 years, and that pilot showed us that our focus on the group of children within early years settings that weren't making age-related expectations, so were falling behind in their communication and language, with the input from the speech and language therapists and with the systematic screening using the Welcome Toolkit, we could see in our evidence at the end that we had managed to shift children from that, the red and amber groups to the green before they started school. So we had a wealth of evidence there that we collected through the programme. And so the St John's, looking at that, agreed to fund a second programme, and we've moved that now down to the Somer Valley area, covering Midsummer Norton, Madstock, Peasdown and Poulton. It includes school reception and nursery classes and private voluntary sector early years settings and childminders. And so far we've had a good sign up down there. The evidence would suggest that if you upskill whole staff teams within early years settings and you have communication champions to take that legacy forward, that you can make a difference if that screening becomes part of everyday practice. And the key thing, I think, is really, it's that amber group of children that aren't going to go on to get specialist support. So they need to have a skilled workforce to support them within the setting on their speech and language skills. And I think that's the strength of the programme, having those specialist speech and language therapists, keeping that contact going, along with the support from the early years service. So we've got a wealth of evidence, and we can share the evaluation report with you from the first pilot, if that's useful. And that's why we've been enabled to go on with further funding.
Thank you. Yes, I think we would like that data.
And yes, we do have some reports which are done by the Council's Business Intelligence team for the Primary Empowerment Project, which does demonstrate some progress. I'm just definitely trying to search through to get it up. It's not open there, but I will have a conversation with St John's, because they're reports which are written on behalf of the Council of St John's, but I'm sure it'd be more than happy for them to be shared.
So yes, if we could have that for the next meeting, that would be great. Thanks, Chris. Not yet, Robin. I have others before you. Onkar, Kevin, and then Robin.
Thank you, Chair. Thank you, Chris, for sharing the report. So just two questions. The first is on the KS2. So what interventions are planned to address the lower performance in KS2 and bring it in line with or above the national average? And the second one on A levels, are there any particular subjects or area where students excel, and what best practices can be shared with other schools?
Just on the A-level question, I'd like to get that information from my intelligence colleagues, but I'm sure we can get that for you, so we can pass that on. The other question's a really good one. So the first question about what interventions and what support were being provided, so the local authority is not responsible for delivery of those interventions or outcomes for those schools. That is, with the majority of schools, it is for the multi-academy trusts today. So I'm hoping my colleagues from Regions Group would be able to give a sense of the work that happens both in the region but across the southwest around improving those outcomes to those children and young people. However, that doesn't mean we're not in that space. So as a local authority, as we said, we are funding a number of programmes. Improving Disadvantage Education Outcomes programme is set up very specifically to provide action learning sets for any schools, regardless of trusts, to be able to learn about best practice and what can be provided for all schools. And we're also going to be looking at where the council can have wider impact on the other factors that contribute to a child's life and their engagement with school, and that will be picked up in our public health report.
Thank you, Chris. So next, as I said, was Kevin and then Robin. Chris, do you want to turn your microphone off?
Thank you, Chair. Yes, thank you, Chris, for the report. Just on the outcomes for free school meals, Key Stage 2 or disadvantaged, those with disadvantaged backgrounds, Key Stage 2 and early years, is there any correlation between the early years gap and the Key Stage 2 gap? And do you think that now the early years improvements are being made, that might also impact on Key Stage 2? Or is that something else that you're thinking of is behind the Key Stage 2 dip?
That's a good question. I think there has to be a correlation between the early years and Key Stage 2. I think the best start in life is something that we all believe in, and the early years is a sector that the local authority can still have a great deal of influence over. So we strongly believe in the work that Language for Life is doing, and the support that my early years team provides settings will have an impact on those later outcomes. Yes. And the second part of your question was?
Or was there something else that you felt was behind the Key Stage 2 dip, if it wasn't the correlation between early years and...
Do you mean the overall percentage? Because the outcomes for all children in reading, writing and maths combined has dipped slightly. The free school meals disadvantage gap has been there for some time.
Yeah, I think primarily the disadvantage gap that we're talking about here. Yeah.
So I don't think it's a dip. It's slightly improved this year, apart from where it was previously. I think it's a trend, it's a pattern that we are in veins at the moment around the outcomes for those children. And I think we need to understand the reasons behind that a lot more, but more importantly, take actions to improve it. So I wouldn't describe it as a dip in veins.
Sorry, Chair, can I just follow it up? So the gap, do I understand it correctly, the gap seems to have got wider recently, in recent years, even up to pre-COVID? When did sort of has the gap been widening, say since 2010, or has it been closing, or has it been staying constant, or?
It's actually closing slightly, and it has been over a number of years, but it's persistent. So whilst it's closing, it's not closing rapidly enough. And if you look at the actual data, the gap where we are and nationally, I still think is quite significant. But it's not getting wider. I should have said also, actually, when you do look at that population of children when they get into our secondary schools, those children start to do better. So when they hit their Key Stage 4 exams, the outcomes for those children are broadly in line with national. So it is just specifically that gap in the Key Stage 2. However, if you look at the outcomes of those children in Key Stage 4 against their peers, so I'm not looking at national, I'm not looking at regional, looking at the children that they're in school with, their results every year get better and better and better in Baines. So the gap internally is very wide for those children. But if you look at the outcomes compared to their peers nationally, they're broadly in line when they get to secondary. So whilst it's good that they're broadly in line with their national, if you look at what their peers in those schools are doing, they're getting better each year. So that gap does widen.
So the actual, so what is it? Is it that those with a disadvantaged background are being tested too early, and then secondary doing something amazingly different to primary colleagues, and colleagues in primary are preparing them well, but they're being tested too early, but they are going to get there, or secondary schools doing something vastly different to primary colleagues? Because there seems to be a very interesting mismatch of how you get those two things happening.
I wonder if this is something that can be pulled up in the next report that we were talking about just now. But, you know, I think that's really interesting. But maybe that level of detail might be tricky to pull out right now. Okay. I'm now moving on to Robin, and then finally, I think, Joanna. Robin first.
Thank you for this report. I think the first thing is to recognise where there has been improvement, and to recognise certainly within some of the statistics how that improvement is above a national average. I think I'm following on slightly from Kevin and from everybody else, is obviously focusing in on Key Stage 2 and where we kind of are with that. And it would be, and it's a what if, isn't it? The results in Key Stage 2, how do you extrapolate those into Key Stage 4 and what impact it has? The paragraphs 311 through to 313 are obviously looking at those statistics, and they are looking at projects that are in place to try to narrow that gap. But what I'm not understanding, and I'm not sure that any of us are understanding, is why that gap is there. I mean, Kevin, it was 2017 through till about 2021 that we were within within 10% of what the national figures were looking like. I think at one point, 18-19, 43% of pupils were expecting to reach the expected standard compared to 51% nationally. So an 8% gap. But since then, it's obviously widened to, we've dropped from 43% to a third, while nationally it's dropped from 51% to 46%. And I get there's part of that is the consequence of COVID and how that gap widens. But whilst there has been an improvement for us from 30% to 33% in the figures for 22-23 to 23-24, that's reflecting an improvement nationally, and probably you can say there's a degree of bounce back because of big peaks of COVID because of that. But, and I appreciate this is a how long is a piece of string question, because if we knew the answer then we could probably have the solution. But why do we think it is that there is this persistent gap in attainment for our most disadvantaged pupils? And why do you think it is that gap has widened since COVID to national figures, and why it remains there? Because while we can say that probably overall, and certainly for some pupils in Baines, they are getting very good outcomes from their education. It is true to say that that is not the case for all young people in Baines, and probably as a local authority, that gap is wider in outcome for individual pupils. So, very quickly, why do you think that is, Chris?
This could be a very long conversation. I'm just going to. So, some of people within this room.
I'm just going to ask Robin if he'd like to turn his microphone off so the camera could be on you, Chris.
So I think we might touch on perhaps some of that work in Amy's report, understanding that, so I wouldn't want to go into that. But there is, some of us in this room were in a meeting with Sir Michael Marmot earlier, the previous week, and listening to some of his research was fascinating. And one of the things that stays with me is that children from poorer backgrounds tend to do worse in schools in more affluent areas, and children from poorer backgrounds tend to do better in school in poorer areas. So there's something about Baines and some of its, I guess, of its national comparative local areas that really needs to be looked at, I think, around that. But it is a huge question, and we could be here a long time. But I hope some of it will be touched upon in a similar report from my colleague.
The numbers that we've got running back are about between 5 and 7 years. Do we have any stats running back to when the early years provision was put in place in the noughties and actually abolished in about 10, 11, whether that gap was still there?
I was actually I've been looking at the data over the past 20 years, I'd say, and for us, in the early years, the attainment gap, the outcomes, I think it's not always helpful to talk about the attainment gap in Baines because the top end keeps going up. But one of the real positives about the 2024 data is that the gap has closed despite the top end going up. The outcomes for free school meals improved 8 percentage points, whereas at the top end it was about 1.5 percentage points. So we've narrowed the gap despite that shift, which is really positive because that's not easy to do. So if you think about it in terms of the outcomes for that group of children, the outcomes for the free school meals group, we've never crossed the 50% barrier, so to speak. And I'd say this year we're at 45%. We're back where we were pre-pandemic, just about 1% below. But it's a positive trend. But what we do know about our data is that when you look at, if you break the data down into the size of the cohort within a school, you can see that where there are more children, the children do better than where there are just ones and twos in small schools. And maybe they don't have children every year. Sometimes they have children on preschool meals, sometimes they don't. And those children's outcomes don't seem to be quite as high. So there's something there, which I think will come out from Amy's report around that small schools, the wealth disparity. There's lots of things that we found out over the years, and that sort of leads to how we work with the early years sector. But then when children go into school, obviously, different curriculum, whole different world. And again, when you go into secondary, whole different world there. So there's different factors, I'd say, at each key stage that need to be unpicked.
I'm sure you'll be paying lots of attention to item 10 when we get to it, Robin. Okay, thank you. Last question, I think, from Joanna.
Hi, thank you. I'm just looking at your recommendations, and it's essentially to note and to be assured. So I know, I've moaned at you previously that we've been in this position before. One of the things that you said is that, that there's a trend and there's a pattern. So I guess my question is, should we not have something as a recommendation as a 5-year plan of action? And I don't ever see that written into these reports. So I accept the political point that Councillor Moss was making about the Labour supporting young people in the early years, and there clearly is an issue there politically that we need to re-establish those spaces again. Let's hope they do that. In that interim, we still need to have a process that recognises that we have massive wealth disparity and those poorest in our areas need better support. And what could that 5-year plan look like?
I think that's a really fair challenge. And yes, last year you rightly did. And every year I should come out. And if you are. And each year I think that's absolutely fine, because actually we should challenge ourselves to do better. And it's probably an error of mine not to include the fact that we are developing an action plan, which will include the outcomes for the wider determinants piece, but also the educational outcomes in that. That'll be part of the public health action plan, and this will be the local authority one. The bit we need to do next, of course, is this isn't just the local authorities within the gift of the local authority to resolve. We need to work with our multi-academy trusts and our leaders in those areas to make sure they're able to be clearly articulate what they're doing in their schools and their trust to support it and be part of that action plan as well. But it should have been in your...
But we also need to work with public health, and we also need to have something in this report that says something about the recommendations for the way forward, and there isn't. So I would insist that next year there is something there, and there should be also working with public health.
It's not there, but we are doing that for assurance.
Well, we hope that that also will be picked up under agenda item 10, but also I think details of your action plan, including timescales, I think would be appreciated when you come back again in May too. Thank you. Before the next reiteration of this whole report, this time next year. Okay. I think I've knocked my sign off. The next item, and thank you very much for your patience, I'd like to invite Giles de Rivas and Tish Bork to address the panel. I believe they are from our regional office for the Department of Education, but if that needs clarification or I've got your title slightly wrong there, then please feel free to correct and then give us a presentation, please, and we will... I hope you will allow us to ask some questions after that. Thank you.
Thank you, Chair. Can I just speak for a minute, please, before Tish speaks? The Department for Education Regional Office, there was a role that was set up with Baines having so many schools in multi-academy trust, in excess of 90%. It means that the way that, as councillors, we engage with the community is really important. In terms of education, and under those circumstances I want to welcome Clive and Tish. We meet Tish on a regular basis, so the situation has changed quite a bit since the regional commissioners were established, because we now have much more regular contact with the Department for Education, and I want to make sure that we just start off this presentation with the frame of mind that we actually recognise that the education in schools is controlled in effect by the Department for Education, but the impact on those communities is still a responsibility that we have. So it's really important. I really appreciate them coming along today, because I think it is important we actually understand how that system works effectively. So I'm sorry I'll cut across, but I thought it was important just perhaps to give a little bit of information. Thank you.
Thank you, and I think that helps with the clarity of the different roles that the regional office and the council play. Thank you. So, back to you.
Thank you, Chair, and thank you, Councillor May. I think that was helpful context. I'll introduce myself first of all. My name is Tish Burke. I am the lead for Baines in the Baines and North Somerset team in the Regions Group. Giles.
Hello, I'm Giles de Rivas. So I oversee what we in our team call the Somerset sub-regions. That covers Baines, but also North Somerset and Somerset. I also oversee our new RISE team, which I'll say a bit more about in a few minutes.
Thank you. So I'm going to speak first to the slides, speaking about, initially, what I want to speak about is the government's opportunity mission, because this is really important in terms of setting the context for the work that we do around school improvement, and in particular around improving our disadvantaged pupil cohort. Then I'll say a few words about the role of the Regions Group, particularly around school improvement and accountability. Giles and myself, we were before this panel about 4 years ago. A lot's moved on since then, so thank you for this opportunity to come back and update you. And then thirdly, as Giles said, he'll speak much more about the direction of travel in terms of school improvement and bringing about high and rising standards. So if we may have the first slide, please. That's all right. I'm happy to kick off. So, first of all, as I said, I wanted to briefly set the context around the government's opportunity mission, and this is very much around breaking the link between background and success. So this is the heart of the work that we want to do to enable all pupils, all our children to achieve and thrive, and absolutely central to the priority around BAMES in terms of improving disadvantaged pupil outcomes. So just to be brief, but to put it into kind of overall what the opportunity mission comprises, there are 4 main pillars. So the first one is about giving every child the best start in life, because we know that this is absolutely essential to bring about opportunity for all. So this is around our policies around quality early years education, as well as family support. On the early years education, I'm really pleased to say that the government's gone live with its breakfast club. And we actually have the early group of schools called the early adopter schools beginning to offer free breakfast in maintained funded primary schools from July. And we've got 2 schools in BAMES that have been identified for early breakfast club adopters, and that's Peasdown St John and St Michael's. And St Michael's has got particularly high pupil premium cohort, so really pleased to be making that impact there. And also around increasing the number of places in school-based nurseries. We've got applications from schools in BAMES to have more school-based nurseries, so that's really positive around giving every child the best start in life. The second pillar of the opportunity mission is around every child achieving and thriving and high and rising standards, both of those points together. So the wider government policy in this area, for example, relates to the curriculum and assessment review, which will be looking at some of the barriers to attainment, but also very much the recruitment drive for 6,500 new expert quality teachers, because absolutely that's instrumental in improving outcomes of all our pupils, but in particular those that are disadvantaged. Just to be complete, there are 2 other pillars to the opportunity mission. The third one is around skills for opportunity and growth. I won't say much about this, just to suffice it to say this is really important. It's around pathways and ensuring our children can stay in education and employment. And lastly, very importantly as well, around family security. So this is about removing the underlying barriers to opportunity. So, for example, the work around child poverty, keeping children safe, and very much so around mental health. So that's just a very brief overview around what the government's opportunity mission is. And as I say, I think it's really important to set the context for the work of the Regions Group around improving educational outcome. So if we have the next slide, please. So just briefly around the work and the role of the Regions Group. So the Regions Group actually comprises 3 main teams. We are the single regulatory interface for the sector. So we bring together teams for schools, children and social care, and SEND. So I'm going to focus my comments on the schools team in relation to school improvement and accountability. So effectively, this kind of blue diagram on the left sets out the roles and responsibilities of the schools team. Effectively, it kind of falls into three main areas. So the first one is around oversight of the academy system. So this is about ensuring our trusts comply with the various regulations and requirements and the laws, for example, set out around financial management, safeguarding, responding to complaints. And similarly, in the oversight, our role in the Regions Group is to oversee the structure of the system. So, for example, in approving as appropriate trusts that might want to grow, as well as the approving mergers if this is proved to be effective in terms of bringing about improved people outcomes. The second main area, very much at the heart of what we do, is around accountability. So that is, as Chris alluded to, holding our trust to account for improved people outcomes. And we do this daily through our daily interaction with all of our trusts, providing support and challenge. But we also do it much more formally, for example, through strategic annual conversations, and as appropriate, attaching conditions. For example, should a project go to advisory group, the advisory board, which is the decision-making body where the regional director will make a decision about, for example, growth or mergers, it might be that we attach a condition for approval. And we've absolutely done that around understanding what action a trust is taking, for example, to improve disadvantaged people outcomes. But in terms of accountability, it is important to acknowledge that where failure occurs, we will absolutely step in. So the regional director has the power to be able to decide to transfer an academy from one trust to another academy if failure occurs, and this is around a poor Ofsted judgment. This is under review to bring around tighter, robust accountability and school improvement, which Giles is going to talk about in terms of the direction of travel. But then, lastly, but by no means last, a key role of the Regions Group is around school improvement. So touching upon all of the issues that we've just discussed in your questions to the Director for Education, Chris Wilford. So this is very much around bringing school improvement. So we do this through our accountability, but we also do it more proactively in the sense that where there is a school that's undergoing failure, we will step in with a school improvement support programme. Again, this is being tightened up under the proposed reforms and it's already in place, which Giles will say a little bit about in a minute. But in terms of the work that we do specifically in the South West, I'm really pleased that we have a number of really strong school improvement networks across the South West that brings together leaders from our trusts. So, for example, we have school improvement networks for improving primary outcomes, secondary outcomes, and a really important active network around improving disadvantaged people outcomes. We have many of our CEOs from our trusts in Baines are involved in these networks. But just saying a few words about the disadvantaged network, this is very much about bringing peers together to identify where there is that best practice and sharing that best practice. As we've heard, we have seen a slight improvement in our disadvantaged outcomes in Baines and some of our trusts, and it's about identifying where is that best practice, how can we share it, but of course it might be that we also need to look outside Baines and look across the South West and nationally further. But one of the particular work strands under the disadvantaged network is particular identifying families of schools at secondary, so kind of matching their progress 8, and as I say, sharing that best practice, because as we've heard, we have got some stronger people premium outcomes in our Baines secondary schools. So broadly, that's our work in school improvement, but of course, working much more broadly with our partners. We've got some really strong partners. We've heard mention of St John's Foundation, the Education Endowment Foundation, and of course the work of the South West Mobility Commission. So it's about working across our partners, through our partners, and of course highlighting the work of the government's subject hubs, for example, phonics, English and maths. Just very briefly, because we are the single regulatory, just briefly on the roles of SEND and children and social care, because of course we know that connectivity that exists, for example, between some of our pupil groups. The role around these teams is very much around supporting all of our vulnerable children to improve and to be supported. So this is around monitoring performance as well as sharing best practice. I'm not going to say anything more about SEND because the focus is on school improvement, but I did just want to say that are, as you will most likely be aware, there is the government review of SEND at the moment. We're identifying reforms. There's nothing further to say at this point. But absolutely, the direction, the policy priority for SEND is absolutely to improve expertise and inclusivity in our mainstream schools. That's absolutely the priority, while recognising, of course, that there'll always be a need in special schools for some of our pupils with the most complex needs. Next slide, please. So we've alluded to the fact of the high academisation rate in Baines. It is one of the highest in the South West. In fact, 2 primary schools have just been approved to join a Catholic trust recently at the last advisory board, so that figure will increase further shortly. And I think that context is really important to recognise for the work that we do in Baines. So, as Chris has just said, they are absolutely your pupils. Baines pupils may be in schools that are run predominantly by academies, so the academies may not be under local authority control anymore, but we absolutely recognise that they are Baines pupils. And that chimes in with our recognition that place is at the heart of a lot of the work that we do, and that it is about working collaboratively together to identify what the priorities are and how we can work together to address those priorities. We've got a really strong Ofsted profile in Bath across our secondaries, most of our primaries. Where there are not strong Ofsted or we have concerns, we are stepping in to act. But actually there is good practice to be shared, and there are some really strong outcomes that we need to recognise. But while at the same time being clear that there are priorities, so Chris has really well set them out, but I think there is sector agreement around what those priorities are. It is around improving reading, writing and maths for all pupils, particularly in maths, and it's absolutely around our disadvantaged pupil outcomes. So we have seen the gap narrow at secondary, but I think we all agree we'd like to see it narrow further, and there's absolutely more work to do around primary. But I'll now hand over to Giles, who's going to talk about the direction of travel in terms of high and rising standards for all pupils.
Thanks, Tish. Hi, everyone. Can you go to the next slide, please? Or possibly, and the next one again. So I was just going to say a little bit, I'll try and be fairly brief, about some of the sort of key activity and kind of measures that are working their way through to move us forward in terms of the way that the department's working and in pursuit of the opportunity mission which Tish has mentioned. So the first of those, and I won't go into detail, is the Children's Wellbeing at Schools Bill, which I'm sure many of you are aware of, which was laid before Parliament before Christmas. So this really is one of the key measures, the key legislative measure at this time for advancing the opportunity mission and for delivering the government's manifesto commitments. It covers a range of areas, as you can see, sort of summarised there. It's had its second reading. It's been through committee stage now, I think, and we're expecting it to progress through Parliament by the summer. Obviously, there have been a few amendments that have come through, for example, around the cap to teachers' pay. So obviously, there may be further changes before it completes its passage through Parliament. So I won't say any more about that. I want to kind of highlight that as sort of one of the key measures that's working its way through. You can see sort of further detail there around individual measures, should you wish. The other thing I was going to mention on the next slide is around the 2 consultations that are currently live, which were launched at the start of February, and which really focus on the accountability system going forward. So there's one consultation published by Ofsted and a parallel one published by the department. So these are, like the bill, these are both really key aspects of the opportunity mission and the work of the department to ensure that every child and young person does have the opportunity to succeed, no matter what their background is. And there's various things which are required in order to deliver that mission. Tish has touched on some of those around the different pillars of the opportunity mission in terms of our support for their start in life and those other elements. those are the policies which are sort of actively working to break down those barriers. But the other necessary part of it is around an accountability system and an accountability framework that works, that is robust, that enables us to intervene in schools that are not delivering the outcomes for pupils that they should, and obviously a renewed offset framework is a really key part of that. So we've obviously already removed single headline judgments last year. Ofset's now consulting on what will replace that, so report cards, the way in which they both carry out and report on inspections. And then the DFE consultation covers a number of areas. Firstly, the general principles behind the accountability system that we have in place. Secondly, around how we present information in a better way to parents and providers, so specifically through school profiles, which will be a sort of digital one-stop shop that will bring together report card information, but also wider information around outcomes and other information as well. And then thirdly, the approach to school improvement, support for failing schools and intervention. As Tish said, we won't shy away from structural intervention when that is what is required, and that will remain the sort of default position for schools that are in special measures. But we want a more refined and a more nuanced intervention approach that allows us to use the right tools for the right schools. And so that brings me on to the next slide, which is around RISE. So, Regional Improvements for Standards and Excellence, RISE for short. RISE teams came into effect shortly before Christmas. We've got our South West team as part of our South West Regions Group team now in place. So RISE ultimately is around driving higher and rising standards for all schools and for all pupils through three sort of main pillars. So the first of those pillars is around targeted intervention. So this is I suppose the delivery of that shift in approach around intervention. As I said, structural intervention will remain the case for schools in special measures. But for schools which are not quite in that position, but which are not delivering for their pupils, what they are now eligible for is targeted intervention through RISE. So the focus at the moment is stuck schools. So effectively what we're talking about there is schools which their most recent offset inspection requires improvement, or if they had an inspection since the removal of single headline judgments, requires improvements for either quality of education and leadership and management. Quality of education or leadership and management. And their previous inspection also requires improvement. So that's the sort of definition of stuck schools. And for those schools, what we are already starting to do, we're working with the first RISE schools across the region, across the country now, is they will be eligible, if it's needed, to receive additional and potentially funded support from a supporting organisation in a much more intensive way than we've been able to do in the past. So under the previous government we had the Trust and School Improvement offer. That was sort of the main school improvement offer that we were able to offer to schools. It was limited to 10 days of support. We're now talking about a much more substantial offer of support, potentially over 1 or 2 years. Throughout the period, there'll be a sort of formal monitoring process, and if through that time improvement isn't seen at these schools, then the possibility of structural intervention does still remain after that period. So that's the first strand of it, is the targeted intervention. The second strand is around making sure that all schools, along with their responsible body, so by that I mean the trust if they're an academy, or their local authority if they're a maintained school, that they are able to navigate their own path to continuous improvement, and this is for all schools, sort of regardless of their position, their outcomes, and their situation. And there's a number of ways which we're doing that. We're very much at the start of this, and we're, I suppose, in a bit of an exploratory phase about exactly how we do this and how we can where we can have most impact. But there's a number of sort of strands of work to this. So the first is around signposting, how we can make sure all schools are more aware of the support that's available to them through hubs, through networks that Tish mentioned, and through other school improvement providers. Secondly, about how we can support and encourage and foster a culture across the school system of collaboration, of mutual support, of sharing good practice. As Tish said, I think we're already in a really good place in the Southwest. We've got quite a strong culture already in this area, but there's definitely more that we can be doing, and there's more support that we can provide there. And then the third strand of this, and this is in fact the third bullet at the bottom, is around how we ensure that every local area has a coherent set of priorities. And for us, it's then around how can we help to convene partners and to sort of leverage collective action around those areas. And again, we're already doing this in many ways, and the work that Tish does kind of with Chris through the Bain Standard Board and things like that is sort of part and parcel of that. So those are the broad objectives of RISE. As I say, it's new. We've been in place a few months. We have now started working with the first schools which are eligible for the targeted intervention. And as I said, we're in a sort of exploratory phase really about what we can be doing and what we need to be doing in the universal space. And as part of that, and in fact, across all aspects of this, the targeted intervention as well, one of the things that's really want to stress is that we're not operating in isolation, us sitting in the department, and we're not taking a sort of algorithmic approach to this. Collaboration, partnership working is really key to all of this, and is very much the tone that we hope we are setting in this work. We're currently doing a lot of engagement with stakeholders, local authorities, dioceses, trusts, and other partners in the system to understand, what really do we need to be doing in the Southwest? A lot of the discussion that we've already had, or you've already had this morning, how can we get really granular about the specific issues, a local area and regionally, which are holding back children, and what can we really be doing at a practical level to address those? We're helped in this in a way which we in the department haven't been before, because we have got a number of advisors seconded from the system, so leaders from schools, from trusts, from local authorities, who are seconding in to work with us as part of the team, and who are really bringing their current, their live expertise and experience from the sector. So we've already got 2 RISE advisors in post in the Southwest. From April, we're going to have about 5 more. We're just sort of finalising the process around that. And they'll be working with us. They'll be working directly with schools and responsible bodies on the targeted intervention. And they'll also be working with us and with other partners as part of the universal service. So I think that's a really exciting opportunity for us to have that capacity and that expertise which we haven't been able to draw on before. So that's RISE. And then the last thing I was just going to say, just the final slide. This is slightly taken out of context because this is a slide which Matthew Stevenson, who's our Deputy Regional Director, used recently when he was talking to your Head Teacher Forum in Baines. And I guess I just wanted to share this really just as an example to sort of illustrate the way in which we are working with schools, the way in which we're engaging with schools, and the sort of messaging that we're giving to your schools. Highlighting what we think, and I hope no one would disagree, are some of the sort of key local issues around disadvantage, around SEND, highlighting the need to be collaborating both with each other but also with the local authority, and highlighting the importance of partnership working, of sharing that practice, of sharing the expertise and the strength that there undoubtedly is in the schools. So I thought that was just a helpful one to end on, just to sort of illustrate, the way in which we're talking to schools and the sort of messaging that we're giving. Thank you.
Thank you. That feels quite exhausting. Okay, so does anybody have any questions? Gosh, all the hands are going up now. So I'm going to start with Onkar, and then Kevin, and then Liz.
Thank you, Chair. Thank you for the report. So just a few questions. So to start with, what criteria will be used to identify schools that require targeted intervention from the RISE team? And how will the RISE team ensure the support provided by high-quality organizations is tailored to the specific needs of each school? And lastly, how will the RISE team address the potential challenges in maintaining high standards once the target intervention periods end? Thank you.
Thanks. Three really good questions. Sorry, I'm just noting down the last one so I don't forget. So the criteria, first of all. So I touched on this briefly, but just to reiterate, so the criteria was announced as part of the launch of the consultation on 3rd of February. So it's out there in the public domain, and it's part of the consultation materials if you want to refer to that. But just in summary, so there's two buckets of schools. Buckets is probably the wrong word. Two categories of school that are eligible. So the first is, as I referred to, the stuck schools. So this is the group of schools which are, under the old government, what was sort of termed 2RI. So schools that have had multiple requires improvement judgments and have not changed structure, so haven't either converted from maintained to academy status or moved from one trust to another, haven't had that structural change since their most recent inspection. I explained that well. So two below good judgments, and they're still in the same structure as they were when they had the most recent judgment. So that's the first category. The second category is schools which are have had an inadequate judgment and similarly haven't changed structure. So that's the current eligibility criteria. There will be a slight change going forwards once we do have school report cards, insofar as there will be new the inspection categories are going to change slightly, but again, the details of what that will look like once report cards are in place is part of the consultation, but it's broadly the same as that. And then the third change that will come is from September next year, so 2026, schools which receive what will be the new category under school report cards of require significant improvement. That's broadly akin to sort of serious weaknesses as opposed to special measures. Those schools will also be eligible for RISE targeted intervention rather than immediately going to structural intervention. Sorry if that's quite a lot to try and get your head around, but the details are all out there as part of the consultation. Secondly, in terms of how we'll ensure that the support is tailored to the needs of the school, really good question and really, really important. And I suppose the heart of this is the point I was making around the collaborative nature of this process. So although this is intervention, and we're very clear about that, this is a formal intervention, we do really want to be working with the schools and with the responsible bodies. One of the key principles behind RISE is around supporting schools to improve within their current structure. And so that's the approach we're taking. So the way in which it will work is that in the first instance, one of our RISE advisors, so one of our sort of sector colleagues who's working with us, they will work with the school, they will work with the responsible body, they will go and visit, they will kind of talk through and get to understand the school's position, the support it's receiving, the capacity that the responsible body has to drive that improvement journey forwards. And there'll be an initial assessment of whether or not there's actually a need for additional support. And in some cases, we expect that actually, the officer judgments being what they are, but actually that school's on a really solid improvement journey. They're getting good support, and there's capacity for that to continue. And in those cases, we won't do anything further. We'll sort of stop the process at that point, but we will continue to monitor it. In other cases, the sort of advice of our RISE advisor who's worked with the school will be actually there is a need for additional support, or there will be benefits from additional support. And then that's when we will match them with a supporting organisation. In most cases in the southwest, that will be a trust because we're a highly economised system, but it doesn't have to be a trust. It could be a local authority partnership, for example. They will then go and do further work with the school to develop a really bespoke package of support, which will then be QA'd by us with the RISE advisors. So that's how we will work with them to ensure that we're not just sitting in our offices saying this is what we need. We're working really closely hand in glove with the school, with the responsible body, and with our advisors to make sure that we're getting it right. And then thirdly, around sustainability, I suppose the key point here is is around the sustained nature of the support. So rather than, as I say, in the past, when we've been limited in what we could offer and funds to sort of 10 days, we are talking about a much more substantial offer over a much more prolonged period of time. In some cases, that could be up to sort of 2 years or thereabouts. So the aim is that with that more prolonged period of support, that will ensure that the right changes are made and are embedded and are sustainable. But as I say, if after that period of time, Ofsted concludes that the school is still not at the pace it should be, then the option does then remain open for structural intervention. I hope that's answered your questions.
Thank you, Giles. Let me just find my list again. Liz, and then Kevin.
Thank you. Thank you very much for your presentation. And it's good to know what exactly is happening. And I'm not trying to be political here, but it's really good to see what a change government is doing. So excuse me for saying that. What you're saying sounds absolutely fantastic, but you do appear to be very remote. And I just wondered, how will the structure work in practice? So, for example, how do you interact with the local authority? So, what exactly is the structure that we're talking about? And obviously, it's the local authority, and then it's educational outcomes, it's Ofsted results, etc., etc. But where does the Department for Education regional area sit? Secondly, how do you interact with our local authority? So, what you're saying is absolutely very fundamental, that you're going to keep a really good eye on what's happening if there are problems with Ofsted inspections, etc., looking at disadvantaged youngsters, looking at improving outcomes for our young people. It smacks of Every Child Matters to me from a long time ago. So how will you work with the local authority to achieve this? And you've stated broadly, in broad outlines, how it will happen. And how do we, as a local authority, know what exactly is happening and what exactly you are doing, how you are relating to our local authority? So it's nitty-gritty digging down into what exactly now happens. Thank you.
I mean, I might defer to Tish on this because I don't feel that we are remote. I think that we are very kind of through our delivery teams. We are pretty well integrated with all our local authorities. Tish works very closely with LA officers, so I might just just say a little bit about that.
Yeah.
If that's all right.
I mean, so first and foremost, as the schools group, the bit of the job that we really enjoy is getting out into our schools. So we're not just in Bristol or Exeter, where the department's Southwest officers are. We are actively going into our schools. Quite often it's to see the best practice for ourselves, as well as to identify where performance might need to be improved and how we can support the school, the accountable body, the relatable body, to make that improvement. But specifically in answer to your question around how do we engage with the local authority, formally, we will do that every short term. I will have a formal meeting with Chris and his colleagues, and that will be predominantly around schools, but also increasingly around SEND as well. So that, and understanding the wider local authority obligations, for example, around people-place planning, sufficiency, and we also know that there's a reference to that in the Children, Wellbeing and Schools Bill. We also do it formally, really pleased to be active partners of the Bain School Standards Board, so I'm really grateful to Chris and his colleagues for giving the Regions Group. We have a standing slot where we can update the sector, but it's also very much, as Giles has alluded to, that collaboration around working with our partners. Where is the best practice? Where is improvement? How can we support each other, as well as promoting involvement in that raft of school improvement activities that I set out? As Councillor May mentioned, we're also pleased to meet now with Councillor May to keep Councillor May up to date in terms of initiatives. But also, as I did allude, it's very much about working with our partners in the local authority. So that is with the diocese, both the Clifton Diocese for Catholic schools and also Bath and Wells for Church of England, but also those other partners. And I think I mentioned the St John's Foundation. We've got a lot of active school improvement bodies, the teaching school hubs. So it's actually, we are absolutely not remote in any way. We are very active within the sector, and we've got really good organisations, and it's really good to be able to work with them to those priorities that we all know exist.
Can I just say, obviously a very clumsy choice of word, being very remote. Thank you very much. You're obviously very hands-on, so thank you for that.
Thank you. Kevin.
Thank you, Chair. I would like to follow the remote theme, although I'd call it possibly a high-level view that you have. From my perspective, we're in a very fragmented system. And if one thing that the government can possibly do is not necessarily extend the DFE into regions, but actually give responsibilities back to the local authority, who work very hard, because children have to be seen as in the whole, and we work very closely in Bath, North East Somerset with health and social care, and those elements in place in Baines, it just seems that what you've suggested so far and talked about are remote in terms of strategies, but the local authority have talked in terms of primary empowerment projects, looking in terms of language for life, looking in terms of public health and wider determinants. So my questions really are around 4 areas, I suppose. First of all, how do you work with health and social care? What support services do you offer schools, such as the SEND and AP service that the local authority offers? What strategies are you employing to close the disadvantage gap? And do you have advisors going into schools, education advisors, and on what basis and how regularly is that employed? And finally, there was a research post in the South West to look at the impact of DFE policies. What has that come up with so far? And it would be useful just to know what's going on with that particular post, please.
Thanks, Kevin. So health and social care. So we've not talked much about health and social care. We've sort of focused mainly on our schools function. So part of the South West Regions Group team, to sort of touch on at the start, is we have our teams which are mainly schools focused and schools facing, but we've also got, as part of the team, who Tish and her colleagues in the delivery team work very closely with. We have a team that we call the Vulnerable Children's Unit, which is focused on SEND and social care. They are a separate team within our South West team, but as I say, we work very closely with them, and they work very closely directly with colleagues in the local authority. It's less directly within Tish and my remit, which is why we haven't focused on it so much, but it is part of the Regions Group's role. It's part of our South West team's role, and as I say, we do have colleagues who are very closely kind of working with colleagues in the local authority on that side of things. In terms of the services that we offer to schools, we don't, because that's not our role. So I'm not sure the details of the sort of SEND AP service that you refer to, Tish probably is, from the LA, but we don't offer that sort of thing. That's not our function. We are central government. We are the regulator. We hold schools to account. We have policies around RISE, but we're not in the space of offering services directly to schools. Schools are run by their responsible body, not by us. Thirdly, sorry, this is where my rapid scribbling trailed off. Sorry, can you disadvantage? You asked about disadvantage.
Well, the same question was posed to Chris, really. What strategies are you actually employing to close the disadvantage gap on the ground?
So I'll maybe let Tish talk in a moment about locally, which is probably what you're most interested in. I suppose I would touch on a few of the broader aspects of the department's policy. Tish has already mentioned some of these around, for example, school-based nurseries, breakfast club. These are these are departmental policies which are aiming to address the barriers for disadvantaged children, amongst others. The curriculum review is obviously part of that. The review of SEND is obviously part of that as well. Tish mentioned some of the work that we're doing So part of what Rise, part of what we're doing through Rise, I talked about identifying and convening partners around local priorities, and a big part of our role is that it's around our role as a convener, our ability, hopefully, to bring partners together. We don't have, we're not directly running schools, and therefore we don't have the sort of direct levers over academies that perhaps local authorities may with local authority maintained schools. But what we are able to do, hopefully, is sort of convene people around those issues and sort of and help to support that sort of partnership working. So that's a big part of what we're doing going to be doing through Rise. And we think that disadvantage is one of the key issues across the region. As I said, what we're trying to do at the moment and over the coming months is to kind of get really granular about that and break that down. Some of the questions which have already been posed. Tish and I and Chris and Councillor May had discussed this in the turning meeting just a few weeks ago and talked about some of the particular things that we would like to do, or we think we may be able to do as part of the sort of ongoing work in Baines. Tish, I don't know if you want to say a little bit more about some of the way in which we're involved in some of the local working.
Yeah, so just picking up on your point, first of all, Councillor Burnett, about the whole child as a whole. This absolutely plays into the government priority enabling all children to achieve and thrive. And so as part of that, for example, our colleagues in the Vulnerable Children's Unit are working with colleagues, for example, in the ICB and NHS England. And so I'm really pleased that Chris was able to involve colleagues from the ICB at one of our recent Baines School Standards Board, and this absolutely also relates to our policy, mental health policy around mental health support teams in schools. So absolutely the child as a whole, understand that point. Specifically around closing the disadvantaged gap, I think it's also important to acknowledge that actually if you improve the educational outcomes for all children, you're also obviously going to improve it for disadvantaged pupils as well. So the work that we're doing around school improvement as a whole actually will also improve disadvantaged pupil outcomes. But looking specifically around that, we have referenced the work of the South West Disadvantaged Network, which is headed up by one of our CEOs from the White House Federation. And we've also, as I said, some of our pupil premium outcomes in Baines, we have seen an improvement across some of our trusts, and it is about sharing that practice. But where there is poor pupil premium outcomes, it is about stepping in and working with that trust to improve that. And we will be doing that, for example, with trust or schools that we think are not adequately performing, and we will be monitoring them to see their improvement to a better Ofsted grade. But it's also, again, as I said, around collaboration, as kind of been a theme throughout our words today. It's about working with our partners, so again, referencing the strong work of St John's Foundation, as well as Social Mobility Commission from Exeter.
And so your last question, I'm afraid I don't know, I'm not quite sure what that post or report is it referring to, so I'm not able to answer that.
Maybe, Chair, you have a better memory than I, but there was, in one of the recent reports, a South West research post to look at impact of DfE policies. Am I just
Perhaps we can take that one
offline. We'll further look. Can I just do one follow-up question, if that's possible, please,
It's a very small question.
Oh, okay, I do apologize. Well, I'm not answering it, Chair, I'm just asking it. So basically, through previous government's cuts and austerity that we've had a lot of, you probably appreciate that all the services around schools, the practical day-to-day, on-the-ground services that we valued and needed, have dissipated. MATs themselves are trying their best, I suppose, to create services that the local authority can't. The local authority doing their utmost to try and coordinate those and work together, but their hands are often tied. So I would just put this to you, that there needs to be possibly more discussion around the fragmented system that we have, that we don't really need government policies and high-power policy makers in the region. We need people on the ground with boots into schools supporting them and I'm sure the local authority can implement any policies that are beneficial to our children, because we agree that quite a few of them are beneficial and we need them. But we need a local authority that is on the ground, in place, actually doing the projects that can get to those children where we need to get to. And yes, you might have to sort of look at that as a system-wide look at how do we improve this system to stop being it so fragmented, and how can we make it the best in Baines we can.
In the interest of brevity, thank you. I'm not sure there was a question there, but we'll take that away. Thanks.
Apologies.
Well, thank you. Yes, I thought it was going to be the other way around. You would have the short question and we might have a longer answer. Okay, so I think the final person on my list is Robin. Actually, it will be Joanna. But I'm going to have Joanna first, and then I will come back to you, Robin, so you can be the final person. Joanna.
Thank you. Thank you for this sort of overview. Certainly support Kevin in what he has to say, that, you know, we have a fragmented system, and what you're talking about is very high level, and what we know on the ground is that we need more people helping the people that are already not supported, and there seems to be less and less to support young people, from what I can gather, than there has ever been before, and that's a terrible place we find ourselves. And we've clearly learnt from various papers that we've had, you know, we've got 20 to 24% of our time is spent in school, and 76 to 80% is spent in the home and the community. And how do we support communities? And that seems to be that what is failing is there's no funding anymore for local government and those community spaces to support young people throughout their early lives and up until 18 is lacking, and there is less and less. My question would be as much to Paul May as to you too. You said there's something about a coherent set of priorities for the local authority to have going forward. I would ask Paul May, how will you be ensuring that we have a coherent set of priorities, and how is that brought to us as a PDS to ensure that is taken forward? And then my other concern too is excluded children. We don't really hear about that group of people, and essentially from my understanding, and it's a lay person's, you know, schools deal with challenging behaviour as much as they can up in infant and primary school, and then when it gets to secondary school, invariably those children are excluded, and that maybe is why we have the disparity in numbers, etc., and percentages that we've seen today. So, you know, how are we supporting that group of people? Because essentially, without supporting that group of people, we have huge problems then within our communities that then cost us money at a local authority level. So I thank the new government for this initiative, but I'm just wondering if it's in the right place.
Thank you. So just your first observation around the sort of fragmented system. I think we agree. Part of what, certainly through RISE, we're trying to do is sort of recognising that certainly in the school improvement space there is a fragmented system, and what we're trying to do is bring some sort of greater cohesion to that. Your broader point around, sorry, I can't remember the exact wording used, but sort of support locally and making sure. The point, sorry, I can't remember what the wording used, but the point I was going to make was, which hopefully then will make it clear what I'm referring to in what you said, was that, you know, a big part of Secretary of State's vision is around bringing schools back into the heart of the community. A lot of the sort of wider measures through the schools bill, through the funding that's been announced in the last budget around school estates, through the emphasis that's been placed on the profession and the work around that, it is, I think, you know, a real shift, a real attempt to sort of to shift the space in which schools are operating and to address some of those issues which I think you were alluding to. On excluded children, so firstly, I mean, a couple of points. As we've already mentioned, there's one of the big priorities that we haven't really talked much about is the SEND system, and recognising the need for significant reform of the SEND system, and inclusion and inclusive mainstream practice is a really key part of that. And I think there's definitely that that touches very much, I think, on the questions of exclusions in some cases. Attendance, more broadly, is also one of the big priorities, and indeed sort of has been again sort of announced as a sort of first national priority that we're sort of really trying to shine a light on through RISE. Again, there's obviously a relevance there in terms of sort of how we're sort of thinking about excluded children. So it's definitely one of the things which hopefully, through RISE, we will be able to shine a light on, where it is one of those local issues that actually we think, and we all agree, there's a real particular issue here that we need to sort of get underneath. Sorry, I feel like possibly slight exhaustion on my part. I feel like I trailed off a little bit there, but hopefully I sort of answered that.
Thank you very much. I'm just going to bring Paul May in now. Would you turn your microphone off?
Thank you, Chair. Just to give you a bit of a break. In terms of setting priorities, can I just say that we work together with the Department for Education through the School Standards Board, and Tish comes along every meeting. That's how we actually deal with the education issues. But there's also the wider priorities around the Health and Wellbeing Board, which has the regional ICB strategies, and we've got a local strategy that we're working on jointly with the ICB. We have on a regular basis a request through to our colleagues, because we're now so small as an education authority. We're then very, very short in terms of resources to be able to put into local services. So that's something where we will keep pressing that on a regular basis. And Tish, she hasn't got a grin on her face, but she knows that I regularly raise that on a regular basis. And on the priorities in terms of SEND, although we're on hold with regards to the safety valve, we do have a proper team that's working to actually get the SEND costs down over a period of years to 2030, so that we can actually work within the budgets that have been allocated. And the other thing is that we've also had several reviews of social care. So we were talking today about education, but as quite rightly been pointed out, the social care side of the department is also active with us. And I think the major issue that I would just vote back is that we actually get better by working with the department rather than standing off and just complaining about what they're doing. And I'm aware that in the past that's perhaps been our need to do that, but increasingly we've seen that the department works out with the local authority, and I think that's actually something that is positive. We might like to see the old system back, but we're living in the past around that. We've got to live and work effectively with our colleagues in the department. So I'm sorry if that's a bit of a political answer to your question, but I think it's important that we actually recognise that there's a whole range of things that we're working on, and working in partnership with, whether it's the schools, the ICB or whatever. We actually achieve more by working together than working against each other.
Thank you, Paul, and that's partly why you're here, for the political answers. Okay, so on my list, I believe, last is Robin.
Thank you very much. Going back to the points you were making about the disadvantage gap, and you've got a South-West task group. And of course, as you know, that was a discussion that we had earlier on in this meeting. Chris alluded to, and if I'm wrong on this, I'm sure he'll tell me I'm wrong, but how the South-West is disproportionately represented in the bottom quartile of that disadvantage attainment gap. Can I ask if there are any particular conclusions from you as a South-West team on what work is being done to look at what are the geographic, demographic, whatever reasons for that particular gap in our region?
I don't think we've got a kind of single easy answer to that. I think there's a range of issues, and it's not the same across all parts of the southwest either. Obviously, you know, it's a diverse region. In some parts, you know, in some parts down to Devon and Cornwall and things, there's particular issues around the kind of coastal communities there, which are obviously going to be kind of very different from the sort of issues that you're seeing in places like Bath or Bristol. So I think we do see there are sort of demographic and contextual factors around the local context and demographics. I think in some parts of the region, I think we do see that there is a question around expectations and aspirations, and I think there are parts of the region where maybe for too long there has been a case of a tendency to sort of say, well, that's what we get, that's what we expect, and so, one of the things that we are constantly trying to do is to sort of shift those sorts of expectations in schools, and looking to put those examples within the region, but also beyond the region, where we can really show actually look what can be achieved. I know there's work around I've forgotten his name now, the Social Mobility Commission led by. Sorry, I've forgotten his name. From Exeter University. So there's some really interesting work that's been done specifically in the southwest, which does draw out sort of some of the factors behind it, which I can't kind of go through in detail here now, but it's really worth looking at. Remember his name? Lee Elliott Major. Yes, that's it. Thank you. So yeah, I mean, there isn't one single answer to that. There obviously are a range of factors, and as I say, what we want to be doing, particularly through RISE, is being granular. Because if we try, if we just take one approach and say the southwest has a problem with a disadvantage gap, and this is the solution, this is the strategy across the whole region, of course that's not going to be effective. We have to be nuanced about it. We have to look at what are the actual presenting issues in each locality, and so that's the approach that we're trying to take.
Okay, great. Well, thank you very much. I think we've all found that to be very interesting, and certainly your answers to be very illuminating. And I'm going to propose that you come back in a year's time, and then we get to see how well it's all gone. If that's okay. I hope that's acceptable, and I hope that the panel agree with my suggestion.
Absolutely.
Good. Right. Well, thank you again. So our next item is item 10 that's been referred to by a number of speakers. So, Councillor May, I believe you're going to introduce the wider determinants of educational disadvantage.
Thank you, Chair. Quite clearly, this is our annual report around education, and one of the key elements that Chris mentioned earlier on was we recently met Sir Michael Marmot, because he went to a regional meeting, and he said about the key stage 2 figures in Bath and North East Somerset were a disgrace, and as a result of that we invited him to come and talk to us, because it was in a regional meeting, and therefore I didn't have the opportunity to defend the authority, but there is a great risk for us as a local authority that we've accepted the key stage 2 figures being really poor, and then therefore you then become complacent because you just accept that that's the way things are. But what's happened, I think, recently is that we've actually put a lot of effort into picking up the issue that Chris made earlier on, and that is that children are in school for only 24% of their time. So it's the wider issue about school holidays and when children are at home, and how we actually develop up the community links. And the great risk, I think, for us as a local authority is that you actually sit there with really important people like the chief executive and the directors, and we drive policies down from the top and hope that they're going to fit to everybody. Because, Clive, you mentioned about granularity. I think it's important that we actually recognise that that's also a risk for a local authority. And what we're talking about here in a minute is about a bottom-up approach, how you work effectively with the communities where the greatest need is. Because one of the key issues that we heard from Chris was that race is an issue for us in Bath and North East Somerset. But when you look at the best performing local authorities, they're very racially spread in terms of those authorities, and it does then reflect the nature of the community that we're talking about in Bath and North East Somerset. So I think this is a really important report that we're going to be dealing with in a minute, and I feel really proud of the fact that we've started to engage with this in the wider approach as a local authority, rather than just saying, oh, well, it's about the school performance. It's about the communities that we serve in the most effective way that we can. So over to you, Amy. Sorry.
Okay. So before we start speaking, Amy, I'm aware that you've sent in some slides, but I don't think we're going to be able to show them today. So what we'll do is we'll circulate them afterwards. So hopefully you won't rely too much on speaking to your slides. Thank you. It's more for people who need the hearing loop. And remote, of course, yes. But can you use a different microphone then for now? Perhaps.
There we go. That's working. Thanks so much. Okay, so I'll just introduce myself briefly. I'm Amy McCullough. I'm a consultant in public health, so I work in the public health team here at Baines Council. Just to provide assurance, we are working really closely with our education colleagues and heads of service across the council on this, and indeed wider partners as well. So this is about recognising that, of course, the work that we do with education settings, preschool right the way through to college and potentially beyond, is absolutely crucial. So we're not debating that at all. But this is about how do we support our partners working with education settings. We absolutely have a role to play. As a number of people have alluded to, we know that children spend 20 to 24% of their working hours in school, so a large proportion outside of school. Therefore, socioeconomic factors and the physical environment in which our children and young people grow up in, so the homes they grow up in, the communities, all of those factors have a crucial role to play in educational attainment. Sometimes there's a process for getting there, so some of that is about encouraging aspiration, self-confidence, belonging. All of those have a role to play in educational attainment. So, as a council and with our wider partners, we are in a position to influence some of those, people call them different things, wider determinants of health or core determinants of health. I quite like referring to them as the building blocks for health and wellbeing and reducing inequalities. So we absolutely have a role to play, and this work is about that. So I'm not focusing on kind of our work with education settings. However, having said that, I think it would be really helpful to bring kind of your work and the action plan and forward planning that you have into this work so that it's articulated in one place. I do think that would be helpful for people. So the aim of this project, I'm calling it a project, but it's to investigate the potential causes of the educational attainment gap in Baines with a focus on those core determinants of health outside of school settings. It's not just about kind of trying to understand those, it's then trying to make recommendations as to how we address the gap. The project has consisted of a number of research elements. So we've looked at what the data tells us, and you can see all of this in the report that we've circulated before the scrutiny meeting. We've also looked at what does the published evidence base tell us. There's not a huge amount out there in the peer-reviewed evidence base. This is really conclusive, so the grey literature has been really important as well. And then we've done a big piece of qualitative work where we've gone to talk to professionals that work with children and young people in Baines, kind of every working day, and who have done, many of them have done for years. And we've also gone to talk to young people as well. It tends to be young people rather than children because it's been helpful to talk to them kind of in a reflective way and looking back. So we've had interviews and focus groups with over 60 professionals and young people, and those young people do include care leavers as well. We've had a multi-partner task and finish group informing this work, so although Public Health have been leading it, it's absolutely not a public health piece of work. It has to be owned by us as a council, by our system partners. So we've had that multi-partnership approach has been really important in informing the work and also ensuring that people are engaged in the work, so that when it's come to developing actions, people are really engaged in delivering on those actions. That's really important because you can have a great action plan, but of course you need to have the engagement to deliver that well. And then we've triangulated all of those findings. We had a workshop as well to inform an action plan, which I will come on to talk about. So just briefly in terms of what the data tells us, because I'm conscious people have had the papers beforehand, you know that the issue has increased, so the number of free school meal pupils has almost doubled. Some of that, though, is about changes to thresholds, and that's something that's happened nationally, so that's not just unique to Baines. We know that poor attainment in a disadvantaged cohort is not restricted to a few schools, so some of the thoughts before we did this work was that it may be, but actually it's more widespread and across schools both in rural and urban areas, therefore we do need to work with all schools. There is a very weak association between the size of the disadvantaged cohort and attainment in the disadvantaged cohorts in our schools. So again, there's a weak association, but we can't say that it's just because we have small cohorts of disadvantaged children in some schools. That wouldn't explain kind of all of the gap. Having said that, schools in Baines with 40% or more disadvantaged pupils have the lowest attainment for both our disadvantaged and non-disadvantaged pupils. So we absolutely need to be working with those schools closely. The next slide that's circulated just gives you an insight into the participants that have been involved in the interviews and focus groups, but very briefly, those in early year settings, primary schools, secondary schools and colleges. One of the Nats, their Director of Secondary at Lighthouse Partnership Trust, heads of service and officers across Baines Council, and truly across that kind of organisational diagram. Young people I've mentioned, that is via Off the Record and Youth Connect, who are incredible to work with. Our voluntary and community and social enterprise sector, so a number of different partners listed there, and then health and social care services. And this is really important. I don't apologise for the amount of work that we've done to listen to people, because I think it's been so valuable in informing what we think are the core factors and factors that are causing or contributing to this gap in Baines. The next slide that you will see talks just as a map, basically, of the different factors and core factors. So we've triangulated all of this information, and that's informed what we're calling kind of core factors, and then factors that inform the core factors. And there's a huge number. And what that really demonstrates, as we were alluding to before, is there is no silver bullet, one silver bullet, that we can solve that would reduce the gap alone. It is really complex, and we need to work across different areas and with our different partners. Just wanted to flag that an overarching factor which people have also alluded to is poverty. I mean, poverty is, if you could solve poverty, you wouldn't have this gap actually, but obviously poverty is incredibly complex to solve. Although the scope of the action plan does include actions related to poverty, it's not owning that action within this action plan, because we also have other strategies and action plans which are addressing poverty, including our BAMES economic strategy. So this work, it's really important that it links with all those other strategies and action plans to ensure that actually where we have a challenge around poverty, for example, that's where we work with the leads and the people working on delivering our economic strategy. That's really crucial to this work. Just to give you a taste of the sorts of things that people have been raising, so this was a comment from a school nurse, to try and kind of bring it to life a little bit. Bath is set up for the rich to get poor, to stay poor. People move into the area from other wealthy cities, their education, those that are wealthy, they can invest in the education. Those that aren't, they can't necessarily, because of a number of complex issues, and the divide gets bigger. And then something very different, a comment from a primary school head teacher. Some children are having to get 2 buses to get home from school, one to get to the city centre and then one to their home. This is much more common for disadvantaged children, for example, those living in Twerton. Those children then can't engage in after-school clubs and homework clubs. It would be dark by the time they got home, particularly in the winter. They obviously miss that kind of key bus, after-school bus, potentially at kind of 3:15. And I guess the next bit that I'll just talk about is, I'm conscious of time, kind of what we're calling the core factors that we think are contributing to the attainment gap.
I've sent you an invite to a Teams meeting if you want to put this up on the screen.
Thank you. Don't worry, I'm nearly there, but thank you so much. So core factors. Now, these all sound quite negative. In the action plan, what we're doing is we're turning them around, so we're talking about them more positively as goals that we want to address. So just to explain, but the way in which we did this research, they kind of sound a bit negative, but it's obviously important that that we're aware of them and address them. So one is barriers to social mobility. I'll come back to that in a moment. The second is barriers to community cohesion, inclusion and equity. The third is an equitable social and cultural capital. And social and cultural capital is such a leveller, as in if you ensure that there's good social and cultural and sporting capital for all our children, that's a huge leveller. Another one is under-resourced home learning environment, another more complex home social environments, another one reduced family and educational setting relationships, another health and wellbeing needs, another reduced early intervention, that kind of offer over a number of years, another limited engagement with services and settings. I'm just going to pick out a couple of those. I'd love to talk about all of them in much more detail. There's a lot under each of those. So some of the specific challenges for BAMES that kind of come out of this work are, one, the visible gap between wealth and deprivation and its impact on social mobility. The vast majority of people that were involved in interviews and focus groups did raise that. There's a really obvious gap. We're a small local authority geographically, and that divide between those that have and those that don't is very obvious. And that's felt to be a real barrier in terms of kind of aspiration and sense of belonging. Another one that was felt to be a bit more unique to BAMES is partly because of that and the amount of wealth that kind of a proportion of people has, is the difference in social, sporting and cultural opportunities that children and young people access. And I think, to be honest, if you went to different venues across BAMES, that's really visible. You can absolutely see that in terms of, for example, those children and young people that attend independent schools and schools in wealthier areas, the sorts of assets that they're using. Another one was felt to be the focus on academia in schools and the impact that this has on employment options and social mobility. So there's a lot in the action plan that we're developing to try and address that. Another one was that linked to really the visible gap, but also how different areas look across BAMES. It was felt, young people in particular felt that there's a lot of investment in how areas look in more wealthy areas in a town centre. Some of that because it's obviously funded kind of through means outside of the council, but that's really important to listen to. Another one was our lack of diversity and the impact that that has on minority groups, because that can really be quite isolating. And another one, which I know that you won't be surprised on, but it's so important that it's reflected here as well. This one came up a lot as well. the large rural communities and the challenges with public transport, impacting access to education settings, public services and youth clubs. When I was talking to young people at a youth club in Polton one evening, I was really struck by a couple of the young people that go to Bath College. It takes them an hour and a half to get there, an hour and a half. And they were saying that often the bus is late. And that's a huge challenge in getting to school. And then I was asking if they attend anything kind of after college, if they join in any of the clubs. But of course, their commuting time is so big, so large, that it's very difficult for them to do that. And we have to remember, these young people are incredible because they may not necessarily have kind of parents, carers that are kind of really encouraging them to do that. So that's kind of some of the core factors, and there's a number of factors which contribute to those core factors. Just briefly about the action plan, I wanted to assure you that we are developing an action plan. There will be around 5 priorities because it's really important that as a council working with our partners that we do have a focus on around 5 key priorities. There are actually currently about 65 actions across the whole of the action plan. I know that sounds incredibly detailed, but actually, because this is working across our core determinants and across different heads of service, each head of service only has a small number of actions, if that makes sense. So I think it is actually appropriate. It's really comprehensive. And because heads of services and our partners are so engaged in this work, they really do want to deliver on those. So I really do believe that we will have an action plan that can be delivered. Just to give you a taste of the sorts of things that are in the action plan very briefly, at high level, some are kind of more around strategy. So, for example, the following will be embedded in the new culture plan. The priority to help address the educational attainment gap by increasing social capital aspiration and social mobility in children and young people from disadvantaged families, for example, by supporting skills and knowledge development, enhancing identity and belonging, and reducing barriers to participating in the cultural and heritage offer. That's obviously quite high level, but it's really important that we have that priority at strategic level, so we have that golden thread going through to operational level. In practice, some of the actions that will be included are that we've included in a bid for National Lottery funding to have posts, outreach posts that will work with children, young people and families to build relationships with communities, target families and settings to support meeting that outcome. So some of them are a lot of them are kind of much more operational and kind of tangible at the operational level. And then finally, just briefly around governance, we think that this work aligns really well with the Be Well approach. That's about taking collective action on the social, economic, environmental and commercial factors that drive our behaviours and outcomes. That's about working at different levels of the system, and it's about exploiting the value of working together on the building blocks of health. But in terms of governance, that would mean that there was a reporting line to the Health and Wellbeing, which is board, which is obviously that multi-partner forum, which is really important. And in our health and wellbeing strategy, we have a priority around reducing the existing educational attainment gap for children and young people. But CMT absolutely wants to have a really close relationship with this work. I'm sure our elected members do as well. So there will need to be feedback mechanisms to various other forums as well. So I think I'm going to, actually, just a final thought, language is really important. I'm really conscious that I've been referring to children and young people that are disadvantaged. That's the way the data describes our children and young people, but many of them do not like being referred to in that way. So I'm just really conscious that in the report and action plan, we try and turn that around a little bit. And some of the work we still intend to do, for example, is linking with our the nearest areas, those areas that are demographically very similar to Baines, where their educational gap is less. So, yeah, that's the sort of work that we're still doing to inform this project. Thank you.
Thank you very much, Amy. That was incredibly detailed. Right, I'm going to ask if anybody has any questions. Can I just say to everyone, though, we're running a bit behind our time, so if you can make your questions relatively short and succinct. Liz and then Joe.
Thank you very much. Huge report, and it's obvious poverty is the answer, isn't it? And then what do you do about it? So I'm going to be really brief. One area of your report said that when we go back to our Key Stage 2 low achieving, that it's schools with a higher proportion of free school meals and more mixed ethnic groups do better at Key Stage 2. And I just wondered, do you know what they're doing that makes it better? Is there something that they're doing, or is it just that there are more of them, so then they have to address it more? That would be me logically thinking of that. But firstly, is there something that they're doing? And then secondly, the recommendations are great. I mean, I really go with, the cultural, sporting, background, parents, grandparents take the kids to music lessons, to football matches, to theatre, to plays, cinemas. Disadvantage, I beg your pardon, whatever form you're using, and we're using it as a shorthand here, but you know what I'm saying. They miss out on this. So in your recommendations, what are you going to put in place? What are you going to recommend that we in Baines can actually put in place, can help to put in place? Maybe you come back next time round, with an update on this. You've said all the things that need to be done, but you haven't actually said how. So maybe that's the next step. Thank you.
Can you put your microphone on again?
Yes, sorry. In terms of the work that's happening with schools, I mean, I guess I've been looking at the evidence base, and certainly from the experience in London, funding does matter. So where you have a bigger cohort, you get more funding. So that gives you more options as an education setting. There were huge gaps in London kind of some time ago, and they've really turned that around. I know that there was additional funding that went into that. We do have differences. I mean, some of the research talks about how in some of the cities which are more ethnically diverse, some of that is around kind of culture and a huge focus on education and educational attainment as part of culture. So I'm familiar with some of those sorts of things. I couldn't kind of say for Baines specifically. In terms of the action plan and culture and heritage, there's a huge amount in here, and I think it would be really great to get elected member kind of feedback. We're nearly there with kind of a good draft that we can share, very nearly there. But some of it, they're really tangible. So, for example, I'm trying to look at some good ones. Engage private schools in the conversation around social responsibility and educational attainment to build partnerships between the state and private sectors that facilitate the sharing of assets, and that talks about various things that can be done there. I'm just trying to get to some of the leisure ones. Encourage external leisure and sporting assets businesses to embed social responsibility aspects to their work where they don't already have this, including by helping to address the educational attainment gap. There's probably about kind of 15 actions essentially under culture and sport that our heads of service are really committed to. But yeah, we can absolutely share that.
Thank you. Jo, was it you on my list? It was, thank you.
I hope Councillor May doesn't think I'm going to be political. It's a fantastic report, and in fact, I think it's one of the best reports we've ever had coming to this Scrutiny Committee, so I'm really grateful to you and for everybody who's been part of this. Certainly the sort of ethnographic level of work of discussing the issues with real people about how they feel about things really comes through, and that's really powerful. As a parent who has brought up 2 children in this city who both went to state schools, I am very aware of the disparity in this city and how my children talked about it endlessly, from schools, taking them to... I was just thinking then when you were talking about sharing assets, I remember them being taken to a private school swimming pool and being astounded about the facilities that they had, and that they then didn't have that, and how that impacted them. And I would say I'm a pretty wealthy parent within the school system. Kevin and I spoke about this before. If you are in the state system, you always feel that there's a group of people that sit in the state system to begin with for a bit, because they know that they can move to the private system, and that sits with an awful lot of parents that they're not good enough. They're not even good enough to speak to those other parents because they won't then be in their world, which will be changed. And that sits within our community all the time, and it is very damaging. So this report really highlights those very many issues. So I am very grateful to it. I would again look at you, Councillor May. We're very good at press statements going out. I would recommend that, you know, we're very good at putting press out within the council about all the good things. The fact that we've got the high-level differences being discussed today, I think is really important, and this report is really important, because I think it will speak to an awful lot of people about how they feel about where they live. And I would recommend there's something comes out of this that goes in as a press release. And I don't know how or what that looks like, but I just think that the community would welcome that that is acknowledged. And even if there is nothing we can do today, there is a way forward from acknowledging that space. That is massive. On a very practical level, the discovery cards. You know, I as a councillor have gone to get my discovery card and been made to feel awful, and that I didn't have the right information, and that I wasn't the right person to go and even ask for that. So if I feel like that, and you all laugh at me because I'm pretty outrageous and outspoken in this room, then how do other people feel? So could we just give discovery cards to children in schools? Is there a better way that that would then give them access to cultural capital? But there is an awful lot I could say too. And my experience too as the chair of the Alice Park Trust is, you know, I've been trying really hard to do things there. And there isn't the funding. I know there isn't the funding for various things taking forward. So the fact that local government has been cut asunder from having funds to support the wider community to then deliver across all of us is affecting the poorest and those on the margins of being poor too now. And it is shocking. And that is not the fault of anybody who is elected in this chamber, I don't think. So again, I just really welcome this work, and I hope that we bring it back to this committee maybe every 6 months, because it's a piece of work that is needed, and how we take that forward is always movable. And should it also be taken to other committees, because, for instance, transport was brought up in this. I've, you know, been championing school streets and how we make those spaces better. But there's a huge amount of work here. So thank you.
Thank you very much, and thank you for your kind words as well. There's a lot in there. I think community is really interesting, because so far we've worked kind of across council and with our partners, including our third sector partners, and obviously listen to the voices of young people. But I think you're right. I think communities will want to have a role. Some people will absolutely know about this gap, and or even if they don't, their work will absolutely be addressing it. And so thank you to all those people out there doing huge amounts of work. But I know that many people won't be aware of this gap. So there is something about ensuring that people know and that they are able to play their role where they want to. I will take back your suggestions around the discovery card. That's helpful, thank you. Transport, there's absolutely an action in here, just so that you know we are trying to make these kind of tangible in terms of the how, to work with and influence WEMPCA, so it's WEMPCA rather than WECA, to work with commercial or tendered bus and train services to prioritise pupil travel to from school patterns, that timetabling routes and concessionary fares support school attendance and participation in after-school clubs. So those are the sorts of things that we're trying to include. But yeah, thank you. I've been writing down your comments, and I'll work with heads of service as appropriate.
Thank you, Amy. I've got Paul, I think, who wanted to come in.
Yeah, thank you, Chair. I'll be quick because I know we're running over on time. I think the
Amy,
press...
can you turn your microphone off, please?
Sorry. The press release, I think, is a good idea. I mean, the simple fact is there's not a single councillor in this council chamber who doesn't care. And I think that's really important that we get that message over, that we work together on that. The second thing was on the funding side. The one thing that Sir Michael Marmot mentioned was that the international average is about 6% funding on early help, and in this country it's 4%. So it is an issue, I think, where funding is relevant, and hopefully he's talking to government and trying to influence the government on that. And we've seen early indications from the government that they're actually looking to do that. And the final thing really is just picking up the corporate element which you mentioned. The Chief Executive is taking a really positive line on this. So it isn't just the Directors of Education and Social Care, it is the whole organisation. So I think from that point of view, it's good that Amy's getting those messages out through the whole organisation, and I hope we'll be picking those things up as time goes on. This is a major, major change in the approach towards education and children, and I think it's a really good report. So I've sat there with my eyes and ears really open, so thank you, Amy.
Thank you. Kevin, Ruth and then Robin, and as has been said, you know, we are really running behind now. So short, snappy questions, Kevin.
Thank you, Chair. Thank you, Chair. First of all, a huge thank you for the report. It just said to me, common sense, makes sense all the way through it. And a huge thank you as a retired head teacher of primary school that actually it's about time that it was recognised that schools don't do everything, even though we do. So thank you, and that we do need support in doing it. I just wondered around you made the point about early interventions, and some schools, certainly in the primary sector, still are coming to me around the services are a bit erratic, health visitors and those key things about starting schools. I just wondered, when you, in your discussions widely, have you talked to parish councils and things? I know in Poulton they've tried to keep youth groups glowing and self-funding. Lots of parish councils seem to be taking up the slack where the the local authority can't because there's no money, and so it goes on the other things. So have you had a chance to incorporate those within your...
That's a really good challenge, and no, and we will do. I think that's really important. That will be an important next step. So although we've done a lot of research, it's not to say that we've done everything that we would like to do, and that would be a really good thing to do. We have picked up on youth clubs and infrastructure, and there's things we can do around potentially Section 106 in terms of prioritisation of infrastructure for people across the generation, but also including for youth clubs. There's a lot of that, some infrastructure has reduced, hasn't it, nationally. That's not just an issue for Baines over the last decade or so. But yeah, we can absolutely link with parish councils. Thank you.
Thank you, Amy. And thank you, Kevin, for your short question. Ruth and then Robin.
Yeah, thank you very much for this report. It was excellent. I wanted to pick up on one of the barriers to improving attainment. You gave as limited engagement right through, really, from early years to youth. So the family setting is really important, and I'm a great fan of the Discovery card and library cards, and would love a lot more, you know, all the children to have one and to get involved, but they won't probably, a lot of them, be able to do anything unless they've got supportive parents or carers to take them to these places. And so really, I suppose, I was just going to say that, and I can see you've suggested a few things, but, you know, how do we offer opportunities to also to the parents, the carers, to get involved, and for them to feel that they can also, you know, lifelong learning, that they can also improve their life chances, as it were, alongside their children's, because there was an interesting also going on that one of the points you made was that in cases where, for example, one of the parents had a higher level of education, even if they were in relatively impoverished, let's say, they were supporting their children more in the home with, I don't know, reading, whatever. So it all kind of hangs together, obviously, but I just think it's so important to kind of, it's not just about the children, it's because the parents were children once, weren't they? And the children will become parents at some point, so it's the generational aspect of it so important. And one other thing I was just intrigued by, on page 83, we're talking about attainment by ethnicity, and saying that the Asian ethnic group consistently are their highest achieving group, Key Stage 2, don't give an idea of how many are in that group. You do say that some of the lower achieving ones, there are only small numbers, so to be wary of the results. But I was just interested to know how many are there in the Asian group, because and what are they doing that is so, you know, I think that's got something probably to do with their family relationships, possibly, I don't know, but it'd be interesting to know a bit more about that, and if we can learn something there from them, and then perhaps moving on from that, I was just wondering about more generally support in other languages, community languages, and support for people and children and the families to improve their English, for whom English is not their first language. So what's being done there, or what could be done there, because I didn't see anything about community languages, other languages. Thank you.
Okay, thank you. My battery is about to go on my laptop, but I've just taken a photo of my notes, so I hope I get through them all. So, yeah, there's lots of different things we can do. Part of this is about not expecting that everyone will come to us that we want to engage with, so we need to take our cultural, for example, offers out into communities. Our head of service is really keen to do that for various cultural offers that we have in Baines. So part of it's taking it into communities and trying to reach, as you say, across families and intergenerationally, because as you say, some of these things are absolutely kind of cyclical. And where parents and carers maybe aren't investing as much in their children's education, that could be because they've absolutely had a poor experience in terms of their own educational experience. Lifelong opportunities, there are definitely a couple of actions for parents, carers. There are definitely a couple of actions that we've developed in the action plan to address those. So when we can share that would be, I think that will be reassuring. In terms of another one that's really important is parent-carer relationships with education settings. This kind of sits partly within this action plan, partly within the action plan that's focusing on education settings, but that is really crucial. So where you were talking about kind of homework, reading, etc. Some of that is about building up those relationships, knowing the family, and supporting them with those sorts of things. We know reading at home, for example, makes a huge difference. Attainment by ethnicity. So I think the action plan is draft, it's absolutely draft, but we've got some really good actions in it. But where I think it falls short at the moment is we need to look at it from a equalities impact assessment perspective. That's still a piece of work that we need to do, and that should pick out things such as kind of where different languages, ethnicity, all those things are important, because at the moment I don't think that it does it as comprehensively as it needs to, but we do plan to look at it through the lens of an equality impact assessment, and that will definitely identify certain actions that would address those specifically.
Thank you, Amy. And the last question is Robin.
Thank you very much, Chair. Brief comment and question within that. I mean, first of all, as with everyone else, thank you for this report. It's really comprehensive, and there are some real nuggets within here about how we can improve things locally and how that will improve things across Baines. I think the technical term is many a mickle makes a muckle, and I'm sure that there are some elements within here that would help that. But again, I'm going back to the absolute versus the comparative, and looking at the figures, particularly the comparative figures about local authorities in the top six and bottom six attainment, particularly within key stage 2. And I guess there isn't a magic bullet, but it is that question of why Baines. Why Baines consistently over the years has had that attainment gap, and why it has widened over the last few years. Narrowed slightly last year, but that's, I wouldn't say statistical noise, but certainly it's only a slight narrowing. And I think it's interesting to ask why Baines, because Joe made the point about funding for local authorities, and how local authorities have been treated really badly over the last 15 years. But if you look at Baines in comparison to Newham, to Hackney, to Tower Hamlets, to Camden, we have done less badly than they have, partly because of the protection that we've had through the Roman baths, partly as well through, I think, money coming in from business rates and the rest. And it is too simple an answer to say it is all down to money and money coming to local authorities, because those top 6 local authorities would not be there if that was simply down to local authority funding. So, again, thank you for the report, and the theme of my questions, Liz, why Baines? Why that attainment gap with Baines?
Apologies, I'd left my microphone on. I think, to be honest, I think it's all of the core factors. There's 9 core factors that I ran through earlier. I'm conscious I ran through them quickly because of time, but I honestly think it's a combination of those 9 core factors, with poverty as an overarching factor, that are contributing to that. I've tried to pull out some of the things that I think are a little bit more unique around Baines, as in the kind of the gap between those wealthy and that aren't being incredibly obvious, and the barriers around social mobility. There is a report that was commissioned across the South West. It actually didn't include Baines, but it included certainly a number of the different local authorities across Baines. And they again picked out social mobility as something that's a real barrier, rather than something that that is an opportunity. So I think it's difficult to kind of hone in on one thing, but I think a combination of those core factors, with some of the things that are a little bit different about Baines in terms of our kind of our geography, our rural areas, some of the difficulties and barriers around transport, I think all of those certainly contribute.
Thank you. And I think it was suggested that we bring this report back, or a new version of this report, in maybe 6 months' time. I think it's been really useful, though, to have this come alongside the other reports that have been delivered through Chris and the regional schools office as well. So thank you for doing that. And we look forward to seeing you again in a few months' time. Slightly behind, as I said, so I'm going to turn now to the Cabinet Member for your update. I hope you will assume that we have read the report you've circulated, so anything now that you say will be in addition, please.
Thank you, Chair. And can we just ask Amy if she can bring back the equality impact assessment as well, because I think it was quite noticeable in terms of other reports that we didn't have the equality impact assessment. But I'm sure if Leslie had been here, she would have drawn our attention to that. So I think it'd be quite good if we could. So can I just start off by reading out a statement, please, Chair, if you don't mind? And it is a statement. This is a key message that's been shared with our 3 local MPs. We are aware of an incident affecting the provider HCRG Care Group. We are working with them and others to fully understand the scale of the incident and any potential impact on health data. Patients should continue to access NHS care in the normal way. While investigations are ongoing and can take time, patients do not need to take any action or contact your care provider. Any individuals who are impacted will be contacted and advised in line with Information Commissioner's Office ICO guidance. So just moving on to my report, and I've just got 1 or 2 quick things. The report, you'll probably notice, is out of timing with everybody else because I wrote the report before we agreed the process today, so apologies on that. And it does pick up the fact, as we say, we're not party political, but the new government is bringing forward lots of new ideas with regards to education and social care. And under those circumstances, I think it's important that we try to keep you informed as time goes on, because some of the issues particularly around early help, which you're going to be picking up as a committee. But it's really important that we actually try to see between the words that are published and the reality for us as a local authority. And the final thing I just wanted to make, I didn't put it in my report, but it's the fact that this is Mary's last meeting. Mary has been absolutely, I can hardly find the right words to reflect how I feel about Mary and the job that she's done. It's an incredibly difficult job, very, very stressful. When you put the quality of the services that are provided by Baines versus the funding that is there for it, it is something where the stress has been absolutely critical, I think, moving forward. And at every stage, I've found Mary to be totally professional, totally effective, and I think of her as a colleague, and I apologise to her if I'm getting emotional about it, because I think it is really important that she's been crucial to this authority, and we'll do everything we can to make sure that we replace her with somebody half as good. Otherwise, I'll take any questions, Chair.
Well, I think before you get any questions, I think what we'll do now is, because you've led us to this moment, I think we would also like to say our heartfelt thanks to Mary and all the support and help that she's given to us, maybe individually as councillors, but also to this panel as well. So we'd just like to say thank you very much. And Jo, may I ask you to... Yes. So if you'd like to... So thank you, Mary. I don't think we'll take any questions at all about the flowers, all right? Okay, so do we have any questions for Councillor Paul May on his report? Can I just stress that we won't be taking any questions about the cyber attack on HCRG, because that's part of a police investigation. So, Kevin.
Yeah, thank you very much. Paul, just first of all, I think to the team and people, congratulations on the Ofsteds and the summaries there for all those services involved. Fantastic. Just a quick question around the Families First Partnership Programme. And is there any dovetailing, can you see any dovetailing with the approach to the wider education attainment gap and things coming in there? And has it got that far yet to link up with Amy's work?
You've not left yet, Mary.
Letting me work. It's turning me off. Thank you. Yeah, so there are a series of engagement sessions scheduled with the DFE, so other colleagues within the Department for Education, not the education. So we've got a series of engagement events this week and over the next coming couple of weeks. And we're entering into what's called a transition period, so 25-26, in terms of looking what those local arrangements could be. So we will need to be identifying a small team of colleagues that will help do that across a multi-agency basis. And I would suggest if we can take a report back to Scrutiny in due course to give some information in terms of the considerations that have been taken forward. But there is absolutely a join-up.
Can I just add that the government has done two trials of this over a period of time through the DFE, and we heard today quite clearly the emphasis around education, but on the social care side, the DFE have got people on the social care side, and I think we'll be adding our invitation to them to come along to the Scrutiny Committee, because I think we've looked at a lot of detail around education, but it's also how we deal with the social care. Earlier on, David mentioned the issue about children in care, how they're performing in terms of Key Stage 2. We hear regular meetings, don't we, about how we're doing in terms of that, but it is something that we actually look to see that we actually do pick up the wider dimensions.
Thank you. Yes, okay, Liz.
Thank you, Paul. It's just an update on the safety valve, and I keep going back and back to this. And I believe there were 6 LAs who were called in, so to speak, and there are about 3 left who haven't heard from the DFE, and I just wondered, have you had any news about this?
No.
That's short and concise.
I mean, when I saw our colleagues outside, I asked them again, just before we came in, have we heard anything, because I knew you would ask that question. The situation is that the end deficit around safety valve is going to be an issue that the government's got to address. For safety valve, in terms of us, they put us on hold, so there was going to be an additional £11 million, which was going to be put into us actually doing all the actions to bring the expenditure down. But that's on hold at the moment, so at the end, our deficit would be £11 million more if they don't get that 11 million. But the deficit for local authorities, they're talking about at least 40 local authorities would have a Section 114 notice if they pulled those deficits in. At the moment, they're held off of our accounts, but it's real money, and our deficit this year is something in the order of £11.7 million. So it is something that is a real tension for the local authority, and it doesn't come up at the budget time because the government's put an extension on the time to March 2026. So it is something that they've got to deal with in the next 12 months, but it is a real issue. And I think at some stage I've asked Chris to go back to Cabinet and inform them a bit more about safety valve. But when you're talking about the budgets, safety valve is all being parked to one side, and I do think it should have some scrutiny by the committee. So I'm very keen to bring it back as soon as I've got something a bit more positive to say.
Thank you, Paul. And thank you for the question, Liz. I think it's one that we've all been wanting to ask. Jo.
Thank you. I have 2 questions. Actually, they're probably not for you at all, Paul. So there you are. You're lucky. Bath Mind phone line is being closed down on the 31st of March. So would you be able to go back to Councillor Bourne and ask how that is going to be dealt with, or is this something that can be answered by this group of people here?
I think it's related to the ICB contract with Bath.
Okay, and then my second question is also sort of, I know we can't ask questions about the HCRG thing because of the inquiry, but however, within that, I have had an email from a resident who says that even before that, they were unable to contact or get through or make comments or complaints to that system, and that they're very unhappy with what is being delivered. So there's a wider issue besides security. So how are residents to be supported?
That's a good question. Can you provide me with that information, and I'll follow that through with Laura?
It may well be, of course, that Laura will have the answer when we come finally to Laura's paper. Robin.
Just adding to what Jo was saying, I think it would be we need to look wider than just mind. Trauma breakthrough, I understand, it's a counselling service, is suspending services. I know that off the record are pausing some counselling advice services. We heard from a group of women survivors at the council meeting last week, pausing services, and those are just the ones we know about. There does seem to be an issue with small, locally trusted organisations not getting funding in a situation where international hedge funds and national organisations seem to be successful in getting money.
I agree with you, Councillor Ross. It's a real concern for us as councillors. The commissioning process has been quite harmful to 1 or 2 of our local providers. I'm pleased to say that the recent youth service has been agreed, and there's been rewarded to Youth Connect South West. So that's one that has actually got through. So I'm really, really pleased about that. In terms of off the record, I'm not aware that we've made any cuts whatsoever to off the record funding. So if that's the case, then they've probably taken that action themselves. And you heard the council meeting about voices. Councillor Alison Bourne and myself are meeting them, I think, Wednesday. We're meeting them on Wednesday, as we promised at the council meeting, Chair.
Thank you, and thank you for giving us a tiny bit, a glimmer of good news as well. So thank you. Any more questions? Anybody that I've missed? Okay, well, thank you very much, Paul, for your report and your, that's what I'm thinking of, candour as well. Right, Laura, you've been waiting for this moment, haven't you, for a long time? So, item 12, Laura's report, the Bath and North East Somerset, Swindon and Wiltshire Integrated Care Board update. Sorry, you can assume that we've read the report. It's really just any updates to the update.
Thank you very much, Chair. Yeah, I think just to draw out for members, in the update we talk about the NHS 10-year plan and the community engagement that's happened. I did just want to note that and to say thank you, because we have had some incredible engagement locally. There is a link in the report for members, and I know you asked about that before, so just in case anyone's missed it, there is an opportunity for you to submit your own views. So I didn't want that to go unnoticed. The rest, as you say, Chair, I'll take as read. And they were direct responses to things that have been asked for us, which is why you have the information before you. So I'll pause there. I know we have one question around Bath Mine, but I'll pause for any others.
Thank you, Laura. I'll go Kevin and then Ruth.
Thank you, Chair. Morning, Laura. Couple of things. First, around the engagement sessions, is that I understood from what you wrote that it's not, you weren't engaging around the outcomes, but how you get there? And is it going to be a local plan going forward, or is this going to be just a national one that will come out of it? And a couple of other quick things. One, any feedback from the schools around the Big Brush Club and how that's working? Then just a couple of items from previous discussions. Pharmacy's review update, is that still happening? The Alice Park Youth Festival, any feedback yet? And a point about the budget deficit and how it was being addressed.
Thank you. I may need some prompts as I take those in turn, if that would be okay. I'll try to capture. Just in case of the pharmacy review, I think as we spoke about previously, that is a complex process, and it is undertaken annually with colleagues in public health. So we're not due at the moment to have that outcome. And obviously that would be required to think about were there any identified gaps and what might we then decide what we would do as a result of that. Members might remember that last time we said that the ability of the ICB is limited, working in conjunction with the local authority to direct provision in certain places, but there are some levers that we have and we can work collaboratively, and indeed we do, with primary care and pharmacy colleagues. So I don't have a specific update on that, but of course, as I think we agreed last time, that's a watching brief, and as soon as we do, I know that you would be keenly interested to have that come back. In terms of the Big Brush Club, we haven't had any formal feedback from schools yet. I think it's early days. I think we do know that these types of interventions previously have been really successful and are widely regarded. Sorry, Chris, you're trying to motion to me. So everybody is aware of the programme and the participation, and I think our expectation is that we'll have high take-up and high participation. We know that, for example, when we've done similar schemes, particularly if you remember, we focused on those with learning disability and or autism, that actually that had really, really great outcomes. So we're quite excited about that, and we can bring back updates on that. Alice Park Youth Festival, I'm looking at Councillor Wright here if I may. I think we had some headlines on the feedback from the festival. I'm not sure that we were due to report anything more formally than that, but I'm sure we can work together if that would be helpful, because obviously that was a huge success story, I think. And then in terms of the budget, we are working through, as we have to every year, our annual submission. We do that in conjunction with the local authority and take that through the Integrated Care Board. And I think it's fair to say, you know, all ICBs remain significantly financially challenged, and that deficit remains. So we do have a significant financial issue at this moment that we need to work through. And I'm really sorry I missed some of the other prompts. So this is the moment where I might need some help, please.
I think actually you covered all the questions I asked, I'm afraid. Yes,
there we are.
You're on the ball.
Fantastic. Ruth.
Thank you. Yeah, thank you for the report. My question was also to do with pharmacies. I don't know if you can help or may have part of the answer. Do you have any kind of update about the jutes, I think that's how you pronounce it, pharmacies? Because there are about 5 altogether in Bath. The one in Weston closed down due to a lack of a pharmacist a while ago. I assumed that with the same name they were all connected, so I rang the Newbridge surgery, and that was fine. But the person working there told me that there was one member of the family who ran that one, and another brother, I think, who's in charge of the other one. So I don't know how the other 3 are doing, but so that any information about that would be great. And then what is the mechanism then if something like, you know, if there is a kind of a chain or a group of pharmacies that are suddenly out of action, what do you recommend to residents, that they just have to then find the nearest one, which may not be all that convenient to reach, of course. And there's a problem, isn't there, if they've already left, a prescription at the pharmacy that has then closed, and they have to ask their doctor to issue a new prescription and so on. But anyway, just sort of is there an overall strategy, or is it just all, you know, you have this annual review where you work out how many pharmacies are needed according to the population, but then is there a mechanism for kind of bringing in emergency pharmacists where needed, as it were? Thank you.
Thank you. And just on top of that, as you know, because we've communicated with you before on this, so the ones that have closed locally are the one on Mount Road in Southdown, the one I think on the High Street in Twerton, and I understand the one in Odddown is, I'm not sure if it's actually shut, but seems to be looking precarious. And I think the concern is these are all ones that are serving areas of deprivation, or certainly of the least wealth in the city as well. So the expectation that they go elsewhere for, you know, regular prescriptions, etc., may not be the ideal solution.
Yeah, thank you, Chair, and for those questions. So I think this is one where we'll take that away and come back with a formal written response. In response to your questions, Chair, as you say, we've been in communication. I've asked our pharmacy colleagues to come back with an update. What I'll do now is expand that so that we can take on board some of the points that you're raising, and in particular the mechanisms. I mean, clearly it depends on the circumstances and the amount of notice that we might have or might not have in terms of the issues that arise. So if I take that one away, and we'll bring that back either as part of a future report, or if we can, before the next meeting, because I realise this is time sensitive.
Thank you, Laura. I think that would be very much appreciated by, well, certainly the communities that we locally serve as well. Are there any more questions for Laura? David, you keep looking at me as though you have questions. Okay. And thank you as well for the way your report was done. I know you were looking to address some of the questions that had previously been asked. I think we might go quick sort of look through previous minutes and just double check that all the questions have been answered within that as well. Thank you.
Right. Chair, I'm conscious that there was a question around Bath Mind. And again, that is part of the Community Mental Health Services framework that we are looking at. So I just wanted to provide assurance that we are looking to recommission breathing space that is subject to a live procurement at this moment in time. Clearly, the issue of the telephone lines is something that is known to us, and that is something that we are also working through. So I just wanted to provide that assurance, and what might be sensible is if we come back with what the model will be for that mental health community services framework, so that we can give you assurance that the service provision for Baines residents will remain safe and effective.
Thank you, Laura. Now, moving on to the next item, which is the Knife Crime Prevention Task Group. So, as you may recall, we were asked to set up a knife crime prevention group to look at the, well, not just the impact, but any learning that we might have from the work that's being done in this area and sort of local to this area and indeed across the country, in order that we could do absolutely everything that we could as a local authority, but also with our partners as well, to ensure that knife crime and particularly the fatalities that were being that we were seeing in rising figures, well, to see what more we could do to reduce those numbers. So I will actually leave that there for now. Obviously, the report is before you. I'm aware Eleanor has been sitting here very patiently waiting to speak as well. So before we turn to any questions or any other comments, I'll ask Eleanor to speak.
Well, thank you very much indeed, and thank you for letting me speak. Unfortunately, owing to illness, I was not able to contribute very much to the final stages of this report, beyond a few noises off. Meanwhile, the deaths continue, if not in Baines, in other parts of the country. And only 2 days ago, of course, two young teenagers, 14 and 15, killed a child in Glasgow. The murders continue, and we really have to get a handle on this. I got involved in the task group, not though from any intellectual interest of trying to get the law altered or the society changed or anything like that, but because Charlie Bates, a young man from Ridlington in Radstock, was murdered in the Radstock Library car park a couple of years ago. And then shortly after that, a 10-year-old was threatening children with a knife in the West Hill play area in Westfield. So it's the tangible human element that we have to focus on, as well as the wider society background. And what struck me about the Westfield child was that his mother was pretty well illiterate. The parish council got a letter from her and deduced that, and it demonstrated very well from what we knew of the family that things were going on from generation to generation. And if there's one thing I would hope Baines would develop a policy on or be moving towards, is how to break this cycle. We've talked about poverty and its influence today, but it's the way it also carries on from generation to generation. The first point I wanted to make, though, was to thank the officer for some really hard work. Councillors may not appreciate always just how much research officers contribute to a report like this, and we've heard, of course, about other reports this morning where the officer has really done a great deal. And also the question of organising the speakers, which are tabulated in the report. That took a lot of work, I know. And perhaps most difficult of all, getting the group of councillors together on the same day to hear the speakers. So I think, you know, full marks to the officer. And I wanted, secondly, to comment on how things have changed. In 2010, when there was a task group from the scrutiny panel looking at youth homelessness and how that was leading to violence. Dan Norris MP went round talking to the young people in the youth clubs around in Radstock and so on, and asking if they were carrying knives or what their attitude was to knife crime. And the response he got was very significant. It was, well, of course we don't. We all know each other. Why would we need a knife? And if we did anything like that, well, our auntie would know immediately. It was a very family society in Radstock and Westfield then, and I believe elsewhere in Baines. But now, it's an entirely different world, what with social media and the influence, possibly the effect of COVID. We've looked at school exclusions and their impact, and it's, well, the question as brought out in the report is whether also the use of smartphones has some effect. I'm not so sure about that, but anyway, we are in a different world, we have a different problem, and how we got from 2010 to 2025 is a really important question. There are three things I wanted to draw your attention to as questions. Firstly, looking at the children who've been murdered, it seemed, and the Glasgow case is typical, it seems to me that very often the victim is what you might call an innocent, an aspirational kid, one who is getting on, doing well at school. In other words, in a different class from the assailants. He was other, and that's the tragedy of the whole thing. If you think of the lives of the girls who were murdered in Southport, they were not in any way, as far as I know, any involved in violence until that fatal incident. Secondly, I'm not sure that in this report we've really taken into account properly the effect of mental ill health and the support that's needed for young people with mental health problems. And, well, we know in the case of the Nottingham murder that it was somebody with a very extreme form of mental illness, not because they were, any other reason. And thirdly, I wonder if we shouldn't have linked it more to the question of bullying, because I do know of kids who've dropped out of school because they were being bullied and then got sucked into county lines and so on. So those are the 3 points I'd like to raise in response to this report. And just to conclude, I would hope that, I think it's right that we're looking at the early work with younger kids and prevention and so on. That's fully right. There is, of course, dare I say it, an ethical dimension to the whole problem, and I would hope, go back onto an old hobby horse of mine, that when we're looking at the agreed syllabus and the changes in RE, we can now, as a result of some of the work that's been done, put in a module on knife crime and why carrying a knife is wrong, or is it wrong, and get children to think in a more moral context, whatever their faith or religion. So thank you very much for hearing me.
Thank you, Eleanor, and thank you also for your contributions to the work of the panel as well. I think your sort of very local knowledge, I think, was quite insightful, when we were drawing not just the conclusions, but also looking at who else we should be gathering evidence from as well. So thank you for that, and indeed to everyone else in this room, and possibly even watching us online, other members of that particular task group. Thank you for your time and efforts as well. So, do we have any other questions from members of the panel? Joanna?
Gender. There seems to be a gender conversation here. I don't want to say it out loud, but I will. It seems to be males carrying guns, carrying knives, using knives. It's not girls, females. So there seems to be a gender issue here, and why is it a gender issue, and why is that cohort of that gender doing that?
should I say this out loud? My sons always had knives, but they had pen knives, and they made wooden spoons and went out carving and did things with them because that was part of the sort of woodcraft folk that we encouraged. So it's how you then use knives and where those knives are used. So there seems to be a whole load there that's not in this report.
Thank you. I think you're right. Gender is certainly a factor within, what we had seen and across the country. I think there have been some reports but they are small numbers of girls that have been involved. I would say probably by and large, you've got, a combination. I mean, to be honest, there's no silver bullets, so it's really hard to absolutely generalise. You don't have what you've got is peer pressure, you've got cultural expectations, you've got normalisation of carrying a knife, you've even got the glamorisation of it, which to some degree things such as, talks at school sometimes actually makes more of, to make it much more of sorry, this is a really rubbish thing to say, but like a cool thing. And the problem you then have, as we discovered, is that carrying a knife can, you could be just as easily the victim as the perpetrator. But taking on board Eleanor's comments as well about the innocents, the ones that have not been involved in this at all. So as I said, there's a huge lot that needs to be unpicked, and that's why one of our recommendations is to kind of pick up that challenge of, is there more that could be done in our early help and early support processes, structures, etc. And that, again, is not just about the local authority, that is about all those partners that collaborate, work together to try and make to create better outcomes from those early moments of life. But we're also looking, of course, as we would be, to what government is putting into the mix as well. So, and I know that we're not particularly talking about that targeted early help piece of work right next, because it's the next item. But, I suspect that item, so that piece of work is not going to be a short, couple of months piece of work. It's going to be a longer term one, because we've got to draw in a wide range of factors and learnings and other things that will come forward within that as well. But yes, totally take on board what you said about gender too. Kermit, was there anything you wanted to add into that? This was my hard-working officer. Is my hard-working officer.
I think it's covered in the conclusions and the recommendations, really everything that we found. So I would just refer you to that part of the report.
Liz?
I think you've got a very good point. And we just made the assumption that it's something that is male perpetrated, that it is to do with males.
Evidence led us to that assumption.
Thank you. The evidence led us to that, all the evidence we had. But I just wondered if we looked at our equalities and maybe included that in a greater expansion of what we said about equalities, that the impact really is on males.
I mean, I would be grateful for that. I mean, I'm just thinking off the top, while thinking. I mean, there is nothing inherently wrong with knives. We have knives in our homes, we cut bread with them, we do all kinds of things with them. It's the fact that a whole group of young men, particularly, are taking them out onto the streets and using them against other young men. And that is our issue. And therefore, in terms of looking at this as a wider context, why are those group of young men deciding to do that? What pressures are they being put under to create that? It's not young women doing that, and I'm not, choosing one gender against another. That is the fact. So why is this group of young men deciding to do this? And that is the crux of the question.
And so that, I think, is picked up in the report when we're talking about societal impacts and, and other influences on some groups of young men. As you say, it's not all young men, and it's not... And you know, there's a whole range of different
But it is now
elements
affecting
with it.
all young men, because, I mean, again, before I came to this meeting, I made sure I had a conversation with a family member who's a young man and asked him about his views and what he thought about knife crime. And clearly he does not carry a knife, but he was making decisions now about where he went, what he did, what times of day he was thinking about doing those things, and what those places looked like, because he was aware that other young men will be in those spaces and will probably have knives. So all young men, particularly, I'm not saying young women aren't as well, but young men are conscious of this issue and are now strategizing their lives around this. Now, young women have equally strategize their lives around gender violence and sexual exploitation too. And women are very good at teaching women to make sure that they go to certain places or carry certain equipment with them. So, you know, there is something here going on that I just think that there's a wider way of thinking about this.
And some of what you're saying will have been picked up by the Violence Prevention Partnership as well. Ruth.
Yeah, I was just going to say, I mean, I wasn't part of this task and finish group, but I think you've done a lot of good work. But I was going to say, from my conversations with other people, I think often, I mean, it's not going to be every case, but the main reason why people carry knives is because they think it will protect them. And then half the time, you know, they end up being the victim. Yes. So, and then, of course, you do get cases where somebody is attacked who doesn't have a knife and who, you know, is totally defenceless and that. But, so I think it's, and also the other thing I keep thinking as well, thank goodness we're not talking about guns, but actually, even though it's illegal to carry guns, I'm sure some people are doing that as well. So, but, yeah, but it's the same principle, isn't it? You know, why do they do it? It's probably because they think it's going to be a way to defend themselves, and then in the end it isn't. So it's trying to find strategies for people to feel safe without having to carry weapons. But age-old problem.
Thank you. Yes, and I think as you've all alluded to, the issue is complex, and there's no immediate, simple solution. Paul.
Thank you. In all the analysis, is there any data anywhere that talks about the types of knives being used?
To be honest, it wasn't broken down into that level of detail for here, but there will be facts and figures about that, because obviously you'll be aware that I think government's brought in a new law around specific knives now being illegal.
I think that's referring to zombie knives, but I mean, I don't know much about this carrying of knives, other than the fact that I have a penknife somewhere in my bag for whittling of water. But these zombie knives are just huge. I don't see how they can even carry them without being visible. So that's why I said, is it the ones that are getting the publicity because they're just huge and enormous, or is the actual damage being done by small ones that can be kept in the pocket or whatever, or kept in the suit? Because with these zombie knives, I just don't see how they can even carry them around. They're just huge. But then I'm not a knife person.
I would say that, as I said, you know, the types of knives didn't come up a lot in what we were talking about. Obviously, some webinars or some meetings we went to, the type of knife was raised, usually by, you know, invariably actually by somebody who had been intimately involved, maybe as a parent of one of the children, either a perpetrator or a victim. So, as I said, it's not, there's no simple sort of solution, but obviously the carrying of very large knives does suggest a certain amount of intent rather than otherwise. It might be better, though, to direct some of those comments towards the violence reduction partnership. So I said violence prevention, but they're actually the violence reduction partnership. If you want to get some more detail on the exact numbers and types of knives that are being used. Okay. So have I got any more? Sorry, Ellen, I can't take questions from... Well, maybe you can pick that up after now then. I want to move on to the next item, which... Oh, sorry, my apologies. I'm being told by the officer, the hard-working officer, that we need to move the recommendations. Is everybody in favour of the recommendations as written? They are to endorse the findings and to agree the recommendations to be forwarded to the Cabinet member for response. Is everyone in agreement? Excellent. Thank you. Right. So the next item on the agenda is around the piece of work that follows on from this, which is establishing a targeted early years and prevention task group. As you can see in the report, there is mention made of the knife crime prevention task group, and so we are being asked to agree to form a task group which does not necessarily have to be made of members of this panel, but you would also wish to delegate the authority to myself and to Liz as Vice Chair to finalise the task group membership and request that the task group's findings and recommendations are reported back to this panel for endorsement. So are there any, does anybody want to discuss, or are you happy to move to the vote? Oh, hang on a second. Liz wishes to speak and then Paul May wishes to speak.
I've got to be really quick because it's getting so late. What are we preventing? Is it carried on from the knife crime task prevention group, or it's, so what are we with the early years? Could we say what the prevention, it's establishing a targeted early years and prevention task group. It's just, it wasn't me who saw this. Somebody pointed it out to me and said, well, what do you mean by that? So I'm not sure.
I suppose it's so we talk about early help, we talk about early support with a view to preventing challenges, worse outcomes in the future.
Okay,
so it is a relatively loose term, but I take that pushback. Okay.
Yeah.
Okay, Paul, would you like to speak?
Yes, just very quickly, that the national scene is changing rapidly, and I think this will be a really effective task group. We've given you the commitment, Chair, that not only will Kerry be busy, but if we can, we'll try and make sure we're giving the support from Children's Services as well, because I think it's a changing world, so it would help us to have that discussion and be involved with it. And Mary's given that commitment, and so is Mandy Bishop. I think the query around prevention is a very good query, and perhaps you'd like to have a think about that moving forward. But I think at this stage, let's see what the government's coming up with so that we can actually make sure we're responding as effectively as we can. But I mentioned it in my report as well, quite clearly. It's something that we've got to be working on, and it's much better we're working on it together rather than you over there and us over here.
Absolutely. So thank you very much for that endorsement. Any more comments, or shall we move to the vote? Are you all happy to support the recommendations? Excellent. Right, thank you everybody. We now have the 2 lots of minutes to consider. Can I just say that if anything is factually incorrect, which of course it would be, and then I've also asked Mark to do is to go through and just make sure that we're picking up on any outstanding actions and actually collating those so that they can all be addressed in case we continue to miss anything. Kevin, what was wrong?
The three points I think of accuracy. One is at the bottom of page 6, which I think should read Not the Select Advisory Council for Religious Education, but the Standing Advisory Council on Religious Education. And then,
You might be correct there.
And then on page 7, it says Bain Sacre needs to have a new agreed syllabus ready to be used by schools in September. Well, technically, it's the local authority that need a new agreed syllabus in place, and Sacre is doing the work and advising it on it. And the last point is page 13 of accuracy. Whiz down to 13, sorry, 9, 10, 11, 12, 13. Just down the bottom. Yes, it says, third paragraph up from the bottom, in relation to the oversight of HERS is run by the RUH Partnership Trust. I just thought it was the Partnership Trust as the multi-academy trust looking after HERS. Now, it could be that there's a RUH partnership as well, but I think it's just the Partnership Trust.
Is nodding in agreement, so yes, well spotted.
That's the matters of accuracy.
Thank you, Kevin. Has anybody else spotted anything that was inaccurate? Okay, is everybody happy to vote to note the minutes, bearing in mind the amendments that have just been made? Okay. Everybody voting? Yes? Good? Yes, Paul did just a minute ago. Okay, lovely. Thank you very much. And then finally, it's the panel work plan. Is there any additional items that you would like to be included in the work plan?
I have been asked about you've talked a little bit about the violence reduction partnership, and it would be good to get an update, especially we've had that challenge about not including the fact that it's mainly males who are involved in knife crime, so that might be a good way to actually address that a bit more.
No, very good.
Okay.
Okay, anybody else? Any more suggestions? Kevin?
Only the wider determinants of
Yes,
come back, but that's...
Yeah, sorry, I've this time round I've taken that everything we suggested during the meeting would have been noted and will be brought back in due course. So, on that note then, as Mary literally, you're the last officer standing. So thank you for your commitment and enjoy your retirement. And again, thank you so much for all your support for us on this panel. Thank you. And on that note then, I am going to close this meeting. Well done everybody, you're 15 minutes ahead of where I thought it would be.